for the midterm, which is next week. So that means we do not have lab next Friday because you have your midterm. So check the calendar for all the dates, all the timing. It opens Thursday, March 2nd at 12 noon, closes Saturday, March 6th at 11:59 a.m., not p.m. Please check your calendar. Make sure you're reading it clearly so that you are recognizing the time that you have to complete your exam. It is going to be 90 minutes as per the email that you got, and also the information on Blackboard. So that's great for you guys. That's 30 more minutes than I thought you guys would have. So that has definitely changed since over the last semester. So yeah, that's great. But you cannot go back, right? And that information is always, that was also given out. In other words, once you submit the particular answer, you should go on. So I recommend that you break down the idea of 70 minutes into 90 minutes and give yourself the, don't go over for anything unless you're moving quickly through some of the questions, right? So if you're looking and you're like, oh, okay, I got this, it's 20 seconds, no problem, right? But you want to make sure you're watching that time because people will still not complete this, right? If they're not paying attention. Please be mindful of the camera. You know, don't give us a reason to don't give the system a reason to flag you and then us to, you know, have to come back and deal with that. I don't want to give you a 0, but if you cheat, you'll get a 0. So don't do it, right? We have respondents to keep everyone honest. And as well, because to be completely honest, I want people to compete for their spots honestly, right? So I don't want people cheating, getting an A when people are working hard and getting an A, right? Because you're going to be competing with other people, and you should have an honest shot at your programs. So it's really important that you behave ethically, and you know the respondents, it's going to pick up on things. So just make sure that you're following the directions. Obviously, you've done your lecture test review, your lecture test already. So it's the same idea. So again, 90 minutes for the exam. Check your calendar. Don't miss it, right? Submit it on time. And there's no word bank. The spelling counts. And it's all the information through exercises 1 to 11. And we're going to knock out 11. There will not be time for a review. So that little piece of information was a nice idea, but it's not going to happen. As you know, Wednesday was the date for you to submit your third histology for feedback. So you have an assignment due on Monday. All of the information is there. I sent you guys an email. The last thing you need to do for the assignment is the scalp or the skin. On Blackboard, it says do 4 times, but you can't see everything on 4 times. You got to go down to 2 times magnified so that you can get the epidermis and the hypodermis. Yeah, that's great. So yeah, and everybody got that email. So yep, everybody got that email. It's all information on Blackboard. You got to stay on top of your emails, guys, and obviously the calendar, right? Got to be proactive. So you have that opportunity to do the review tomorrow. But again, I can't review if I haven't completed the content, which we haven't. So, you know, that's just the way it is, and that's okay. We have to, you know, finish the content. So that's what we're going to do today. We're going to finish page 75 and 76. We're just going to move through that, but we're going to be here the whole time because it's going to take that long to finish. Any questions about that? Logistics around next week? Yeah, we don't have class. You've got a few days span to go ahead and do your test, 90 minutes, 70 questions. Everything is under getting ready for the lab midterm. So remember, you're going to see the images on Blackboard, and you're going to be expected to label basically 66 questions. And there'll probably be a couple follow-ups based on the blue boxes. Page 32. What about page 32? What about page 32? That's part of it, yeah. That's part of getting ready for the lab midterm. You have to know all of the lab drawings associated with mitosis. Pretty much everything that you labeled, you should know, right? You got to know prophase, metaphase, anaphase, telophase, interphase. You've got to know chromosomes. You've got to know spindle fibers, aster, all the stuff you labeled. Are we getting the review for the histology till Monday? Are we getting the review for the histology till Monday? Oh, you're going to get the feedback tomorrow. I'm sorry. Is that the question you're asking? The feedback for you guys will be tomorrow. Yeah, you'll get that tomorrow. Yeah. No bones, right? Bones Bones, yeah. What do you mean no bones? Guys, it's through exercise 11. Page 75 is exercise 11. Of course there's going to be bones. There's going to be bones and bone markings, right? Calendar, guys, the test covers exercise 1 through 11. That's why we have to finish that today. So everything that we're doing today is going to, it's got all this information is going to be on the midterm as well. Based on the calendar, we don't have a pre-lab due on Monday, just the histology. Yep, but just go by the calendar. So you have Monday, you've got the histology due, and that's it, because Monday, March 8th is the next homework assignment that you have. Again, everything that's due is in the calendar. Always go by that calendar. Don't go by, I can't say it any clearly than this. And I know that Brisa, I know that you don't have a problem with that, but just in general, there's nothing more I can say, because it's on there. So no, go ahead and ask Tanya. Just making sure. Yeah, no, it's good. It's definitely, yeah. And you're right that there usually is one, but if there's not one, then you're good. Okay, Tanya, you have a question?
Yes. Is the midterm for lab and lecture? Is that
No,
is this midterm is
they're,
or
they're completely separate. So so this calendar that you have is specifically for lab. Lab and lecture are completely separate classes. They go together in terms of, we want you to learn the information together. Lecture is completely separate. All your tests are on your your lecture calendar. You can apply to that. You can look at that. Lab is going to be the midterm that you see coming up here. So we keep them separate in terms of their calendars. So if you want to see when things are due, look at your lecture calendar, which is on your lecture class in Blackboard. And then for this one, we have the midterm. So they're completely separate.
thank you.
You're welcome. All right. And then somebody asked a question, just making sure, because we should, okay. Is there a picture of a tiny bone on the blackboard that I cannot identify? There's a picture of it. Okay. So I'm at the end of class. Go ahead and let me know what tiny bone that is. But remember, we haven't gone through all the bones yet. So guys, let's finish the content first, which includes those bones under facial bones. So again, just keep in mind a couple things to remember, guys. Everything that's under I finished everything on Tuesday with my Tuesday class, so we should finish everything today, which means everything that's covered, we've gone over. Once we finish today's class, everything that's on the midterm. Now, the only thing that I'm not covering is there's a box on page 75. It says you should know the significance of the bone markings that have a star. I'm not going over that. I'm not going over because that's in the textbook. Like literally just look at the stars under the textbook, in the textbook, and just kind of make sure you review that. Those I'm not going to go over. Like I said, it's all in the textbook for that little box. Otherwise, everything that you're expected to label in the list after today, we've gone over. So, let's just finish it, and then we should have gone over everything. We would have gone over everything. Okay, guys? So, again, next week's your midterm. Everything through exercise 1 to exercise 11, which includes the bone and the bone markings, are going to be on next week's test. Okay? Most of it is going to be labeling. You're going to see a picture. There's going to be a follow-up with the tissue, like where do you find this tissue? What is the function of this tissue, right? So that's kind of it. Yeah, I know. But again, there's no way around. You have had to have been studying the entire semester. Does that mean you can't do it? It means you're in a pickle if you're starting now. I mean, I'm not going to lie to you. You need to study every day and you need to work hard, but there's absolutely no doubt that everyone in this room, in this Zoom room, should have been studying the material since every day that we learned it, right? And by doing well on the histology assignments, you were studying and getting points for that. So, it's tough managing the pre-labs because that's relatively a lot of work, right? Because that's still quite a bit of your, it's 15%. And that's not going to really do much for the midterm. What you need for the midterm is getting ready for the lab midterm and memorize it all. You can. It's just what I hope hasn't happened is that people have been studying. That's what I hope has been happening. And that's what I hope, because there's no other way around it. There's no magic bullet here. There's no magic anything. If you have not been studying, getting ready for the lab midterm, you're not preparing correctly for this test. And again, because I've had to say certain basic things over and over again, there may be some people that are not quite listening to me. So last time, guys, we you should be studying all the pages that say getting ready for the lab midterm, and Shannon helpfully right there, she put those pages. You have to double check it, make sure everything's in there, right? But that's what you need to be studying. All of those lists you should have memorized. Obviously 75 we're going to finish today at 76. All right, guys? It's literally memorizing all of it, right? So that's it. So if you have any questions, we'll get to that, but there won't be a review. We just won't have time. You can go to tomorrow's review as per your email. If you're not checking your emails, guys, what can I tell you, right? Certain responsibilities that you just got to take care of. Okay, any other logistical questions? Okay. All right, so that's basically where we are. So I'm quite sure that we finished the occipital bone last time, and I think we started with the sphenoid, but I'm just going to start with the sphenoid just in case we didn't, finish all of it. So again, where are we? You should have your lab manual open at page 75. It's not an option, guys. This isn't a recommendation, right? You need to have your lab manual open at page 75. We are doing the cranial bones of the skull column, and we are currently on the sphenoid. The rest of the pages are all highlighted like this, so you should be following along. You should be making whatever notes you need to in your book, right? That's your responsibility, and everything that you have here, we go over. Right? So none of this is superfluous. None of this is just a waste of time. It's all to prep you for the midterm, and then obviously after that, the final. So for this one, it's exercise 1 through 11, including what we're going to finish today, 75 and 76. All right, guys? So let's go ahead and jump in, and let's go ahead and knock this out. All right. So sphenoid bone. So first of all, the sphenoid bone, then, you're going to see it on the skull, which we talked about in basic bones right there, right? You've got two things called the superior orbital fissure and the inferior orbital fissure. You can find those on the skull here, superior orbital fissure and then inferior orbital fissure, right? But where you're going to find the superior orbital fissure in addition is on the individual bone. So get your images from Blackboard. Now, you will notice that I have some images that are not from Blackboard because they're labeled. And I was like, that's cool. That's going to be helpful, right? And then I have some illustrations, in other words, some textbook images, because I'm like, hey, that's cool too. That's going to be helpful. You're going to be tested on the images in Blackboard. So those are the images that you should be using to study for this. Now, you have your own resources in the form of the atlas, which is great, and in the form of the textbook, which is also great. The difference is that atlas will use actual pictures, where the textbook has beautiful images, but they're often not actual bone images, right? They're like drawings. So they're both helpful, and you want to be using those to make sure that you're getting the images. So that's what you see from the perspective of the superior orbital fissure and inferior orbital fissure, okay? But you will most likely have the individual bone, sphenoid bone, which we'll see in a moment. In terms of this image, what we did, this is going to be the top of the skull, right? And it's an inferior image, so you're going to be looking at the bottom of this, right? And this is just turned upside down. So basically what we have is we've got the sphenoid bone right here, right? It kind of looks like a bat. It's got some eyes, and it's got this weird thing here. So in this image, you have to go inside the bone to be able to see something called the sella turcica. The sella turcica is a little saddle. It's actually a Turkish saddle. That's what it translates into. And it's just like a saddle where you would kind of sit. So this area here is the sella turcica. Okay. Now, we've got a couple areas where you want to know. The optic canal is one of them in terms of the hole. That's obviously where the optic nerve is going to go through. Now, we talked about this before, that here, well, I might not have talked about it so much with you guys. Wherever you have the bones, you have to find a landmark, right? You have to be able to associate, orient yourself very, very quickly. For me, when I see something like this, I'm going to go with that foramen magnum as my kind of landmark that I'm going to be able to find things around. Here, the foramen magnum is a big hole, right? The brain stem is going to go through here. And if I go just a little bit lateral to that, I'm going to get the jugular foramen. These are very big holes, okay? So I really need to be able to see this type of image. Again, this image is from Blackboard, the kind of gray in the back, and also the Kimberly Dutton, our photographer. Those are the images from Blackboard. Yeah. So most of these are from Blackboard, but some of them I picked up because, they're just helpful. And so I kind of added what I thought was helpful. And then again, here we're going to go up a little bit, and you can see this really nice oval type of opening, which is called the foramen oval. Here, we're really going to be more in line with the sphenoid bone, right? That sella turcica there that we see. And then as we go back up, as I mentioned before, this area is going to be the carotid, the optic canal. The carotid canal is actually over here, but you can't see it very clearly. All right, jugular foramen is not on the list. It is. It is just on the temporal bone. So we covered it already last time. Yeah. So it's not. It's again. Remember, the temporal bone is going to be over here. Over here. Oh, I take that back. So the temporal bone here followed the suture. Here, 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 and then we've got the sphenoid bone, kind of like that. So this is the temporal bone. So I'm just kind of emphasizing that in terms of a landmark. Okay, just like the foramen magnum, it's not on this list. It's going to be on the occipital list. All right. So some of these, I've kind of double labeled in terms of a couple of the bones being part of that. But just kind of the idea is the same, that you want to make sure that you're orienting yourself around a landmark. All right, awesome. So we did the superior orbital fissure, inferior, sella turcica, optic foramen, or canal, right? You choose which one because it says or. And then the foramen ovale, which I just talked to you about. So again, this obviously, what we're talking about here is going to be in the sphenoid bone, right? So that way, it's going to be more like that. I keep going around the foramen ovale. That and that are going to be part of the sphenoid bone. Okay. Here, in this image, you cannot see the orbital fissure because you really have to have either just the individual bone, which we'll see momentarily, or potentially the skull. That is a possibility for the superior, especially the inferior orbital fissure. All right. So let's keep going. Now, here's an image of this is the blackboard image of the sphenoid bones. You have to know the bones individually. So you have to know the temporal bone, which we went over, and the occipital bone, and this one here, which is the sphenoid bone individually. So what do we have? We've got something called the pterygoid process. They look kind of like little legs, and that's just part of the bone. Here you can see this is the superior orbital fissure. You cannot see the inferior orbital fissure in these individual bone images. So that's why you could get a frontal, an anterior view of the skull to get that inferior orbital fissure on the sphenoid bone. Okay, all right, and so that's what we have here. You can also have the carotid. For this one, you can have I keep saying carotid canal. It's driving me crazy. The optic canal, but I want to show you an image. Oh, the pterygoid process. Whatever you want to call it, it doesn't matter. As long as you spell it right, it doesn't matter how you do it. Now, I want to show you guys something. So I want you guys to follow my rationale here. So this is kind of a heavy image intense slide because this is the image you're going to see on Blackboard, Kimberly Dutton, right? So this is how they've done it, but it's a little bit hard to orient yourself. So look what I've done. Now, you're going to see this orientation. You're not going to see this orientation, but I wanted to make it a little bit more accessible. So this is what you're going to see as a possibility, or this image, right, guys? So that's two different type of images. This is looking down, and this one obviously is looking more to the side, where the pterygoid process is actually on the other side. You can't see it. But what I did was, in order to kind of give you a better understanding, this is the superior view where you're looking down. This is the view that you saw with the skull. When we look down at the skull, the kind of eyes over here, and you've got this part coming out, and here's the foramen ovale, right? So that's the skull image that we just saw. Yeah. So that image, and again, I pulled off some other illustrations because this gets kind of tricky. It gets a little bit tricky this way. So again, this is fine in this image. You can see that you need this image for the superior orbital fissure, and the pterygoid process, you need this image also. So let me keep on going. We can come back to it if we have time just a little bit. What I did here so that you can get a better optic canal image is I flipped it. So I flipped this image so that you could see this one is upside down. Why did I do that? Because now this image is the same as this image, right? And you have a little bit more access to being able to see what it is. Yeah, it honestly, it took me, I had to spend a little bit of time, and I literally flipped this image. So again, you're not going to get this image on the test because they can't flip an image around, right? That's craziness. You're going to get this image. But like Emanuela experienced, I found that the way that this is oriented a little bit tricky. So if you want, what you can do is just take a screenshot of this and follow along what I'm saying. This image is kind of what we saw in the skull, right? It looks like a little dragon, right? This looks like the dragon's head. This looks like the dragon's eyes, and this looks like the dragon's wings, right? So that looks like a little dragon. So, but in order to get the little dragon, which is the sphenoid bone, I had to flip it so you can see the little dragon's head here, the little ears, the little wings, and then here you can see the foramen ovale at the bottom. Do you see that? See guys what I did there? Yeah, he's lying down. Or well, maybe not. I mean, he could be. Yeah, he's lying down if we consider the gray thing the ground. Exactly. So yeah, it was difficult. So I wanted to reorient it. Right. Again, dragon head is what you see in the skull that I showed you, because you could clearly see that optic canal. Right. It's difficult to see it here because this is actually the foramen ovale, and here you can't actually see the optic canal very easily. That's why what I did was I flipped it, and again, this is going to be the foramen ovale. Here's your foramen ovale. The sella turcica is easier to see when you flip it, but it's basically in this area here as well, right? And then the optic canal, you can't really see it. It's here. Do you guys see what I just did? It should be more of a hole, like this, like that, like that, like that, like that. Do you guys see that? So again, this guy's sleeping. The dragon's sleeping here. I know it's lame. I know. Follow me. Just follow me here. Yeah, Gloria, you meant this guy's lying down. Okay, I get you. Sorry, I was thinking about this guy. Yeah, in the image that you'll see from Blackboard, he's lying down. That's why you got to kind of, again, they don't have a really pretty optic canal, but that's where it should be. And then here, they have a really pretty foramen ovale. So that's why I wanted to, I had to take a minute and flip this bad boy around a couple ways so that I can get it to where it makes sense. So again, what I recommend is while I'm doing this, just go ahead and take some screenshots so that you see, because again, please note, you're not going to see this image. I flipped it upside down so you can see what it would be like in an anterior facing, like when you've got the anterior kind of going where my hand is here, right? The way that I showed you in the other image. How did they do? I hope they do use that to ask for the optic canal. Yeah, so again, the way you orient yourself, optic canal is going to be the opposite area of the foramen ovale, right, guys? Let's go back so I can show you something again. Again, this one you really cannot see because you're not seeing. It's almost like you're seeing the back of the dragon here. It's almost like you're seeing the back of it. And I know I'm calling this bone a dragon, but follow me here. So let me go back up here. So do you see the dragon face here? You see the eyes of the dragon, the ears of the dragon, right? The wings of the dragon, right, guys? And there's the foramen ovale. You guys follow me with that? Yeah, because it's tricky. It's not bad on the skull. It's tricky with the actual bone itself. So it's weird, but honestly, guys, that's what I got for you, and I'm okay with that. So again, you can see dragon head, and it's a sphenoid bone, but I'm just saying, right? Here you see a beautiful optic canal. Come back down here, right? There's your foramen ovale. There's the sella turcica. So again, jumping back over here, we need this image for the pterygoid process, which you don't see in the dragon head, right? And then here you've got the superior orbital fissure, which you also don't see in the other one. They're going to be fair with the pictures. It's just that this one is particularly challenging. So that's why you got to come to class, which you are. You got to pay attention, which you are, because honestly, guys, y'all know that we've gone over everything. I mean, really and truly, we've gone over everything and we've taken our time. So you know what I mean? And the ethmoid is tricky, but I got you there too. So just stay with me, right, guys? We got this. So again, some of these images, and you could be taking screenshots throughout, I don't care. But some of these images you probably want to screenshot so you can kind of take your own notes. Does that make sense, guys? So something like this, very straightforward. You can see how that all falls into play. No problem, right? Now, this one, not bad. Yeah, you know. No, they're gonna use the Blackboard images. They're gonna use the Blackboard images. All these gray ones, the gray background, or the ones that say Kimberly Dutton, that's all Blackboard. Like I said, I add some myself so that some of them are labeled, and I'm like, hey, that's gonna be helpful for my class, right? So obviously, I'm gonna use what's helpful. But you're all gonna be tested on the images. So all of these are all Blackboard images. Okay, guys. So again, here we go. So I think that's not bad. You got the skull, you got the Paraguay process example with the superior fissure. Don't worry. Remember, guys, we haven't gotten there yet. So just give me a chance to go through it. I think you guys know after all these weeks, after 10 exercises that we got this, right? So you got to show up like you guys are doing. You got to pay attention like you're doing. And then you got to take care of it. Yeah, I know. And I know you guys you're doing what you have to do. And that's why, for me, I'm doing what I have to do so that we all make sure that everything gets done properly. So that's why you can see for this image, I kind of went overboard on all the pictures, because here's an image of the bone with a illustration. And that's kind of what I wanted to do. So, because sometimes you need that reference, right? Oh, thank you. I appreciate it. I'm not trying to say stop, play. I'm like, shut up. I'm not done yet. But seriously, if we haven't got there yet, you know that we're gonna take care of it. So, but again, that's why this is. There's a couple that are tricky. The hip is tricky. I'm not gonna lie to you guys. The hip is tricky. So we're gonna get there, and just like this, I got different images, right? So don't worry. Again, that's why you come to class. If you didn't need me, then we wouldn't have this class. We would just have some videos. But we want to give you an actual instructor, a live instructor. All right, so that's what we're looking at here. This is the image. This is not the image because it's rotated. But what you get now is you can see the dragon, right? You can all see the dragon here. And in the dragon here is where you should see the optic canal. But this image is not super clear where the optic canal is. Just know that it's in the opposite of the foramen ovale. So there's the foramen ovale. Here you're going to get the optic canal as the eyes of the dragon. Okay, guys, you got that? And again, optic canal, optic foramen, whichever one you like. Awesome. Good. Because again, not bad. It's really not bad. But like I said, you gotta orient yourself. But at least the thing is, no one's gonna look at the sphenoid and say that's not the sphenoid. Like, it's the sphenoid. You know what I mean? Like, there's no way around this. The sphenoid. It's just, I don't want you to confuse the optic canal here, because you can't see it very clearly. You just can't. I'm not even gonna pretend you're looking, going, where is this thing? You can't see it very clearly. Yeah, I'll go with a dragon. That's okay. Just, we'll pretend that sphenoid bone is Latin for dragon. But I don't know. Just make sure you didn't say that I said that. All right, silly people. All right, awesome. But take the thing. I think you can understand that, and that's why I went with this one and then came out. Because I was looking at this for a hot minute, and I was like, we're gonna have to rework this bad boy. But this is what you have to know. So, foramen ovale. Here's where you're gonna get that optic canal. All right, and guess what, guys? That's it. That's the sphenoid bone. Okay, ethmoid. So I got you here too. Not bad, right? So here we go. That's the entire ethmoid. You have to know this. You have to know all of these bones individually, because you're gonna get them. You're gonna get individual bones, which we're gonna go through. So that makes sense. So that's the ethmoid. Let's go through and just look at a couple more things. So, a couple things that we want to find out here. First of all, this is called the Crista galli. Do you guys see that? It's like the coxcomb, the top of the rooster, right? The little kind of red thing that comes out. So that's the Crista galli, just that part. Now, the cribriform plate is all of this kind of spongy-looking bone beside it. That's the cribriform plate. So the cribriform plate is the red, and the Crista galli is the blue. Boom. You're done. Okay? I pulled the Seth Meyers there. Sorry. Oh, Lord. It's the weekend. So, anyway. That's it. That's the Crista galli. The blue, the cribriform plate is the porous stuff, because actually that's where you have the neurons for smell. That's where you have the olfactory neurons that go up through this area, because it literally has holes in it. And then you're going to go into the brain and process smell. All right, so that's it, guys. Now, we also have to know the superior and middle concha. So let's see what the best image is for that. Okay, let's go back up here. Now, I want you to notice something. Under ethmoid, it says superior and middle concha. The superior you really can't see. Hold on, guys. The superior you really can't see. So what happens is we're going to show you the middle concha, which is like here and here. That's the middle. So we're going to put like an arrow there, and you're going to say superior and middle concha. Okay, guys? Because you really can't see the superior. That's why we have it together. So we're going to show you this, the middle. Theoretically, we could show you it in the skull, because in the skull you can see the inferior nasal concha, the middle, and the superior. The middle and the superior make up the ethmoid bone, right? You can't see the superior in that anterior view of the skull. You can see the middle concha and the inferior concha, right, guys? And even here, oh, and actually here, let's see this. Here is the Crista Galli. It's a little bit hard to see because of the orientation. That's the Crista Galli, and then the cribriform plate is just around it. The Crista Galli sits on the cribriform plate. That's how it works. Right, guys? You got that? The blue is the Crista Galli, and that sits on the cribriform plate. Both of them are part of the ethmoid bone. Okay? We can ask for ethmoid bone, Crista Galli, and cribriform plate. Yes. I'll put an arrow. There, and there. Okay? Because remember, you've got kind of like that right and left. The arrows are the middle. The arrows are going to be the superior and middle concha. That's what you want to label them, although technically what we can see is the middle concha. Does that make sense? So the arrows, yeah, no problem. What you're going to write is superior and middle concha, although technically what you can see is only that middle concha. You can't actually see the superior, even in the ethmoid, because it's kind of all up in this area here. Yes, Jensen, go ahead.
So you're saying in the midterm that we have to put superior and middle.
Yes. Now, why would I say that? Everybody, turn to page 75. And under ethmoid bone, what do you see? Write it out for me, everybody. Yep. Everybody, look on page 75, under ethmoid, which is under cranial bones of the skull, and write it out for me, exactly what you see there. The whole thing. The entire thing. Yep. Write it out. It's time. Everybody write it out. More people. More. I want more people writing it. Keep going. Keep going. Keep writing it. Come on, give me more writing. That was me being obnoxious. You're welcome. So yes, Jensen, that was me being obnoxious. I'm not being it towards you. But everything that you're expected to know exactly as you're expected to write it is on the list. Right, guys? Does that make sense? So now, that's why, so the thing is, Gloria, the reason why we put those together is because it's very hard to see and find and separate the superior. Frank's like, all caps. Now he's messing with me. Wait, where's Austin? Yeah. So do you see what I mean, Gloria? And you'll notice that in a couple places. Like for example, osteocyte in lacuna. Notice that in the hyaline cartilage under the slides, they want you to separate. They want you to label it separately, but in the bone, the compact bone, they want you to say osteocyte in lacuna. That's because it's hard to separate them, right? Oh, no, Frank, don't apologize. I'm totally, even if you were yelling at me, I totally am fine with that. Trust me, I'm super, super easygoing, and so you don't have to worry about it. Austin! Sorry. The name in blue is called the Crista Galli. So the name in blue is called the Crista Galli. The red part around that is called the cribriform plate because the Crista Galli sits on the cribriform plate. And just to finish up what I was saying, just kind of with Gloria and a couple other people, the reason why we put some of these together is because it's hard to find them individually. So those arrows are pointing to the middle concha because you can't really find the superior concha. So what we want you to say is the superior and middle concha. Does that make sense, guys? So again, we go over everything here, guys. All right, Gloria. So you got me. So I hope that didn't take you. I hope that didn't frustrate you too much. But that's literally what we do because it's really hard to find that superior. Good. All right, guys. Awesome. Guess what? That's the ethmoid. Except I want to show you. Okay, so here's the ethmoid. Guys, why don't you put a line where the Crista Galli is? That's it. That's what I want. Whoa, that's a really big Krista Galley. Wow. I don't know what happened. It expanded in size. Just the middle part, guys. Just there. All right, that's right. Perfect. Okay, I like it. And where is I'm going to erase that and tell me where the crib reform plate is. Crib reform. Not crib or not form. Crib reform. That's it. Don't go too far back. It's where there's holes there. That's it, guys. Awesome. Obviously, this entire bone is the ethmoid bone, right, guys? So if they put this picture up and say, what bone is it? You're going to call this the ethmoid bone. If they put an arrow and ask what's the structure, you're going to say, well, whatever they're pointing to. That's right. Ethmoid. Exactly. Awesome. Theoretically, one could say that this would be the superior and middle concha. I don't think they would ask in this orientation, though. I think that's slightly janky. All right, awesome, guys. Is there 2 questions for each number? I don't know what you mean. Oh, no, there's 1 question for every number. So there's 70 questions. 1 question, 1 number. Now, you might have a follow-up. So, you might have a picture with 2 questions, but they're 2 separate questions. So there's 70 questions with 70 numbers, but you might have 1 picture where one says, I don't know, what is this tissue? And then the second question for that image might say, where do you find this tissue? That would be the only difference. Halima, does that make sense? Good. Janky, you're welcome. I bring the science. All right, silly people, let's go. All right, so mostly bone. No, I would not say mostly bone questions, although yes, there will be a lot of bone questions. Yes, there's going to be a lot of bone questions, without a doubt. So, I mean, if you think about it percentage-wise, I don't know, maybe 40% bone, maybe, all right, guys, I really want to make sure, I want to answer your questions. Please make sure you're following along with me, right? Because if I answer a question 3 times, you've got to stay with me and pay attention, right? So it's going to be here, and this is going to be the superior and middle concha. You can't see the superior. It's going to be the middle concha. That's what you see. You label it superior and middle concha. Again, I don't mind asking your questions, but if I've answered the same question 3 times, guys, just please stay with me, because I wonder if you're listening for the first couple times, right? So I'm just, as a human being, that's what I'm wondering. So please stay with me as I go through this, okay? All right, so that's what we're doing there. That was the middle concha, which we're going to write superior and middle concha. All right, awesome. So here again, you feasibly, now this is not our bone, but it looks like one that we have. So I just wanted to show you, here is where you can find the ethmoid. The Krista Galley is sticking up here, and then the little holy part around it is called the cribriform plate. Okay, so that's what we see here. All right, awesome. And I think we're fine here. Again, I've added just some extra stuff, some extra images. Now, let's go on to the facial bones of the skull, okay? And the facial bones of the skull are going to start with the mandible. So I'm going to come back to this if we need it. All right, so here's the mandible. This is all our images. You have to know a couple things. You have to know the mandibular condyles. Obviously, this is labeled here, right? So here are your mandibular condyles in the back. In other words, that's posterior. The front is called a process. So that's the coronoid process. Now be careful, guys, because we have a coracoid process, which you're going to see in the scapula, and we have a coronoid process, which you're going to see here, and you're going to see on the humerus. No, it's on the ulna. So, sorry, I had to think about that. So you have a coracoid process, which is on the scapula, just repeating myself. You have a coronoid process, which you see here. This is the mandible, right? And then you have another coronoid process, which is on the ulna. So you got to be careful, guys, right? Just be mindful of similar things. So mandibular condyles is the posterior part here, and the anterior part are the coronoid process. So be careful, don't mix them up. And then the mental foramen. The mental foramen are simply the holes that you see in the bone, right, in the mandible. And then lastly, the alveolar socket. You can get alveolar sockets here. The socket is basically, it's where the tooth fits into the actual mandible, right? That's the gymphosis joint as well, which is immovable. So just FYI. All right, awesome. So that's what you have here. And that's the mandible. Now, just a reminder, guys, you can be asked for the bone. And if you're asked for the bone, what are you going to say? What bone is that? Mandible. That's right. And then, of course, those are the 4 bone markings that you could be asked for that. All right, awesome. That's it. Now, again, guys, what are we doing? We're going top to bottom. Now, some people use the 6-day method in the lab manual to learn the material. There's like a little 6-day method where they break it down. That's great, but again, just chunk it. Learn the cranial bones, then learn the facial bones, learn the thorax, like go through them and chunk that in this order, exactly the way they have it here. So maxilla, there's the maxilla, right? Here we're going to have this goes right up. Remember we talked about the maxilla, that's lateral to the nasal bone, right? So there you can see that's gonna kind of pop up right beside the nasal bone, right? But right kind of behind this, kind of posterior to this area is where you're going to find the lacrimal bone. And then we go into the skull, which is the ethmoid, and then the sphenoid, from kind of the front to the back when we do the side of the face. This is right. This is right. Oh, sorry. Wow, my brain did not process that. I was like, yeah, that's right. Oh, by the way, you don't have to know right and left for the exam, but for this one is right because you can see that that's a molar, that's the front, that's the right. So yes, and this is left, but you don't have to know right and left for the exam. Dr. Casey sent an email out. Read your emails, friends. Read your emails. He sent that out at some point this week, so you don't have to know right and left. Okay, but yes, right. Well, this one's right. That one's left. Yeah, exactly. Stephanie, you're checking your email. We appreciate you. It's not that we don't appreciate everyone else. Yes. Just memorize everything. Don't get too excited. All right, guys. So what do we have here? Remember that we have the palatine process and then we have the palatine bone, right? So the palatine bone is in the back. Okay, right? Remember, guys, we have the palatine bone that's in the back. So the palatine process is in the front. You can't see it here. You got to see it here. So that front part, the anterior part, is the palatine process. Together, these two make the palatine, the hard plate. Oh, I'm so glad. You come to my class and you suffocate. You get a good email and you're like, yeah. Sorry guys. Yeah, sorry. Oh, I feel bad. All right, so I know you're JK. All right, guys. So palatine process. Show me where the palatine process is on the left. You really can't see it on the right. It's covered. Go front a little bit more, guys. Yeah, that's it. The palatine bone's in the back. Don't go back. Don't go back. Don't go back. Don't do it. Very good. Awesome. Good job, guys. All right. Now, how do you know that, in case you're wondering? Let's look at a different orientation. Do you guys remember this orientation? That's not it. Where's my... There you go. You guys remember this orientation? Palatine bone is here. That's right. That's the palatine process in the front. You guys remember that? That's the bone, right? And then in the front, by the teeth of the maxilla, right? That's the maxilla. We've removed the mandible. That's the palatine process. All right, awesome. Good job, guys. All right, so not bad, because the hard part, and I'm not going to lie, I don't want to make you guys anxious. All of this is doable. The hard part is the hips. That's honestly, it's tricky, but I got you. Don't worry. The ethmoid was in the middle. The ethmoid was in the middle. Yeah, hold on. Okay, hold on. The ethmoid was in the middle. The anterior middle, yes. You see this one up here, guys? Oh, but that's not even that. Hold on. You can't see the ethmoid here. This is the vomer. This is the vomer. You can't see the ethmoid. And actually, it's probably down a little bit more. Yeah, you can't see the ethmoid here. You can see the ethmoid here. The ethmoid is right here. Which one? You don't like this view? Wait. This view? Wait, which one? Which view? Sorry. This view. Yes. Now, guys, this is our view. I can tell by the gray in the background. So, just FYI, this is our view. Okay, guys? Again, as we're going through this, just take the screenshot. Do you know what I mean? Like put it in a Word document, right? And then you can have a little bit more information to go off of. Okay. Now again, Atlas. So Atlas. All right, guys, awesome. So not bad, not bad. Remember process like extensions of it. Yeah, yeah. They're like parts that stick out. Exactly. All right, guys, let's do it. Let's do it. Let's do it. Wait, wait, wait. Did we finish the maxilla? Yeah, and alveolar sockets, guys. Guess what? Same thing. Boom. You got an alveolar socket in the mandible. You got an alveolar socket in the maxilla. Boom. Remember process is like go back, go back, go back where? No. Go back. No. Remember, I don't know. I'm confused. All right, let me know if you want me to know. So remember, the alveolar process
I'm
is
sorry, I was
where
saying
the
go
tooth
back
goes in.
to the Palatine where you had that different view and you couldn't see the ethmoid.
Ah, okay. No problem. All right, hold on, guys. This one, right?
Yep, that one right there.
Okay.
Yeah.
Yep. So, yeah, a quick picture, and then you got that, and you can come back to it, and you can see where it's labeled. Now, remember, it's that whole area that's labeled. I'm pretty sure
Got it.
this is armature. Okay, good. Awesome. Good job. I feel like it is because the gray, that gray background. This is not. And again, guys, some of the pictures, I'm just adding. We've got that gray background. All right, awesome. Okay, awesome, guys. That's it. Boom, boom, boom. Da, da, da. Again, here's another image that's the same idea, right? Here is the palatine bone, palatine process, right? That's why you've got both the bone and the process when you have, because they cut it down the middle when they give you the maxilla, right, guys? And then they just give you the maxilla, right and left. All right, awesome, that's it. All right, again, just repeat it. All right, guys, that was the maxilla. Now, here's the little bones. Somebody was like little bones. Well, guess what? We got little bones. Now, this one, sorry, hold on, I had to go back. Palatine bone. I do not believe there is a separate palatine bone. So the palatine bone is here. Remember, palatine bone is the posterior part. Palatine process is the anterior part. Infraorbital foramen. Hold on. Oh, I didn't do the infraorbital. Wow, thank you. Give me a second, because this isn't the image I want. All right, so, NES. Oh, well, no, this is the image I want. Actually, no, you're right. Thank you. See that? That's the orbital. That would be the superior fissure. Inferior. That's the sphenoid. That's the nasal here. That's the NARS. Your nostril. And whoever did that is awesome. That's exactly correct. Good job, guys. So that blue part there. Aww. That was so good. Thank you, Gloria, by the way, because honestly, I just didn't even see it because apparently my eyes don't work. My brain and my eyes are not connected. Yay, go you. All right, and Gloria, thank you. Good job, guys. Woohoo. Awesome. Okay, so left. Let's redo this. Palatine bone is here. Palatine process is in the front, right? And then in the infra, I'm gonna let my Oski go ahead and do it. You can do it again. Go ahead. She can do it because she did it first the first time. Where is the infra? That's right. Somebody just stole her thunder. Oh, just kidding. That's the infraorbital foramen. Again, because that's the orbit. That's its superior superior orbital fissure. The inferior orbital fissure. The nasal bone goes here. The NAR goes here. That's the infraorbital fissure. That's great. Like it. Good job. All right, guys. Thank you. That's good. I like it. Very good. Not bad, right? Not bad. The hips, we'll make it through. We'll do it. All right. With that being said, this is the zygomatic bone. Honestly, I don't see it in relation to what it looks like on the full skull, but it doesn't matter. It looks like two horns. I don't care. You got the two horns, you call it a zygomatic bone. All right, guys? That's it. That's it, exactly. Oh, look, it has horns. That's the zygomatic bone. Oh, look, where's my dragon? Okay, that's the sphenoid bone. Whatever, I don't care, right? Just don't say that in a clinical setting or people will be like, what the heck? Fishtail, perfect. I don't care what you think. It's a mermaid. Just look at it and then call that the zygomatic bone. All right, guys, you with me? Awesome. It's a tooth. I don't care. Vampire. I don't care. Whatever you see, just see it and name it the zygomatic bone. All right, guys, you got me? So, because I'm going to show you something else in a minute. Snapping turtle. Great. Awesome. That's it. All right, now, this one, so the really tiny ones they're frustrating because they're very tiny, right? The best thing I can say association for that. All right, it's a tonsil stone. I don't know what a tonsil stone is, so all I can say is whatever. All right, guys. Now, don't get too frustrated. Just they are gross. Listen, I didn't say it. I don't know what's going on. All right, some of these you just got to flip back and forth to make sure that you just know them. I know that doesn't, but trust me, it's gonna get a little harder in a bit. All right, now a boot. It's a boot. No, it's not. It's Italy. Exactly. And you guys just heard my awesome Canadian accent if you were listening. I still have it after 20 years. So yeah, I look at this and straight up I see a boot. A boot. Anyway, that's the nasal. I know, I am. Yes, I am. No, Gloria. You are evil. Gloria Wynn is evil. Austin. Yes, I'm even more likable now. It happened, didn't it? You found out I was Canadian, and you guys were all like, oh my God. And if the government can ever get their crap together, I'm getting my American citizenship. I've only been here for 20 years. Anyway, back to class, people. So when I look at this, I see a boot. And it's the nasal bone. Okay, guys? That's it. All right. I think this is easy, right? A. You guys are wrong. I never said A. That was never a thing. Shark tooth. Exactly. Whatever you like. I kind of see a janky lightning bolt. Right? Oh, your neighbor does? Well, slap them. Yeah, exactly. Whatever you see is great. And the vomer is very obvious. So, vomer. All right, that's it, guys. Okay, not bad. Now, here is okay, I don't see this. I'm going to be honest. Now, that inferior nasal concha, watch this, guys. Watch and compare it to the lacrimal. Because if we can go only by orientation, then we can see that this is lying more parallel and it's shorter. But you got to be careful with this lacrimal and then the inferior nasal concha. Because you can see, this one's a little bit longer, but if you're not careful. Honestly, I don't see this, but that's okay, because that's what they said. So I'm going to go with that. It's an inferior nasal concha. Another wad of gum. Awesome. No problem. You guys got that? Not bad. Yeah, that's not bad. All right, guys. So let's keep going, because it's not, again, just take a quick snap of it, take the screenshot, and then you're good to go. All right, taco. Sure. Awesome. Go for it. Baseball glove. Amazeballs. Basically, nothing else points like this, so that's easy. All right, guys. Hyoid bone. That's it. I don't know what else to say. It just looks like that. So, honestly, that's it. All right, awesome. Yeah, no, don't get frustrated with this. Don't let it scare you. Remember, the ones that are obvious, knock them out. Vomer is obvious. The nasal is obvious, right? Those are obvious. Wait, yeah, the nasal is obvious. You got to compare and contrast the lacrimal with the inferior nasal concha, because they're not so obvious, I think. Well, the one on the left is. It looks like, it's got some things sticking out. Nothing else is pointy like that. And then, of course, the zygomatic, fishtail, horns, whatever you want. So really, the only thing that's really a little bit confusing is comparing and contrasting the inferior nasal concha, which is longer, with the lacrimal. Other than that, guys, not bad, right? Compare and contrast. All right, awesome. That's it. Hyoid bone, honestly, it is what it is. All right, guys, sternum. This is the sternum, right? We got a couple parts of the sternum. We've got the manubrium, which is this. It looks like the tie, the knot on the tie. Did I just make it 1,000 times easier? What? It's because I'm from Canada. No, I'm kidding. No, but seriously, that's really the way you want to do it. You want to compare and contrast the hard ones. I know. Oh, I also blame when I screw up that I'm from Canada. I'm like, oh man, sorry guys, because I'm from Canada. I don't know, it goes both ways, right? All right, anyway, yeah. So the manubrium here is going to be just the part that looks like the knot in a tie, because this looks like a tie, a man's tie. And then we have the body, which is just right here, as you can imagine. Right? It's kind of like the shaft. And then we have the jugular notch, which is right here. I put a helpful little arrow for you. Oh, snap. I put a helpful little arrow. Now, guys, don't be confused about this jugular notch. It's the notch, right? It's the indentation on the bone. That's it. Okay? It's just the way that the bone goes down like that. Yeah. Yep. I know. And that's okay. That's okay. That's why we go through everything. Right? We go through everything. And we have time to. So I'm sorry we can't review, but I like the pace we've gone at this class. I do. Like, lecture is just insane. No, it's not. It's actually a bone marking. Right? Everything that's not a bone is a bone marking, even if it's not sticking out. If it's an indentation, we still consider it a bone marking. It's just part of the bone. Do you guys see that? So it's the bone. It's the bone, but it's where the bone indents. It's that part. So it is the bone. It's just where it indents specifically. Diana, does that make sense? Right? It's just the indentation of the bone. All right, no problem. Awesome. Then we have something called the jugular notch, which is this. You can actually see the line. It's this little line here. That's the jugular notch. It's that line. And yeah, it's the top area that goes in. And then the last one is wait, what did I just call that? Wait, did I call this the sternal angle, or did I don't know what I just said. Sorry, guys. Did I call it the knot? Yeah, thank you. I did. I don't know what happened. Wow, my brain. It's like the foot all over again. All right. Wow. Yeah, sorry, guys. I literally wow. That's the sternal angle. Wait. Yeah, it's the sternal angle. Yeah, it's the sternal angle. The notch is at the top. It's just my brain walked out of the cranium for a moment. It's back now. Canadian brain. That's it. Yes. And it's hilarious because the damn thing is like labeled here. So it's not like out. Austin, it's all good. All right. Canadian brain, that's right. So the sternal angle is literally right here. It's that little, it looks like a line. It does look like a knot. But the notch is up here. It's an indentation. Okay, awesome. Can we trust you? No. I mean, notebook slap for myself? Can you trust me? I don't know. I think so. I think I've done a good job. Now, I realize what happened with the clavicle and the cuboid, not clavicle, the cuboid and the navicular. I thought about that for a while. And this one, I just had Canadian brain. I have no excuse. I just literally have Canadian brain. But guess what? I labeled it for you, which means I did some quality control, right? It's not all me. I know. Helena's like, get moving. I've got 1,500 questions. Xiphoid. Xiphoid is here. It's just a little part on the bottom. That's it, guys, right? All right, guess what? Xiphoid process. The bacon is good. Yeah, I've heard. All right, guys, that's it. And then we're going to come back up to this, but we might as well do it now. So I'm jumping a couple, I'm looking at ribs for a second, guys. At the bottom of the ribs is the costal cartilage. So this is the costal cartilage here. Right? Now, again, this is Kimberly Dutton, so this is our image from Blackboard. So this is going to be the costal cartilage, right? Not a big deal. Now, I want to show you guys something here. So I'm bringing in the ribs to this. So we just finished the sternum, hoorah. So look at this, guys, for a second. 1, 2, 3, 4, 5, 6, 7. I'm going to stop here for a second, right? Those are the first 7 ribs. And we call those true ribs because look at each of those costal cartilage. They join on to the costal cartilage, which joins onto the sternum. So the rib doesn't directly join on the sternum. The rib has its own costal cartilage that joins on the sternum. Do you guys follow me here? Boom, boom, boom. Now these ones here, they're going to be 8, 9, and 10. But notice how they don't have their own costal cartilage. And that's why 8, 9, and 10, and 11 and 12 are considered false ribs. Exactly. And that's it. I know. Yeah, Shannon, I'm with you, but just rub your eyes and pretend you don't see it. That's also the Canadian in me. So it kind of does, but it kind of doesn't. So we kind of go with, okay, 7 are true because of what I just showed you. That makes sense, guys? That's it. And yeah, that's awesome. All right. So I jumped on the ribs. This is a, wait, oh, you want to go back? Yeah. Question? Yes, 1 to 7 are true. Ready? I'll do it one more time. 1, 2, 3, 4, 5, 6, 7. True. This would be 8, 9, 10, which are beginning of false. And then 11, 12 are in the back. Sounds like a test question. Yeah, because guess what? On page 75 under ribs, true and false versus floating. Now, guys, true, what Myosty wrote there is correct. 1 to 7, true ribs. 8 to 12, false ribs. Even though 11 and 12 are considered false, 11 and 12 are also considered floating. They don't even make it to the front. They don't even articulate with costal cartilage. Yes, exactly. That's correct. You guys good? So that's correct, Jennifer. All right. Woo! A. Manubrium. Looks like the little knot on the tie. Exactly. Whoever's got there, that's exactly correct. False and floating. Now, false ribs are ribs 8, 9, 10, 11, and 12, right? 11 and 12 are floating. So two of the false ribs are floating, which are 11 and 12. All right, awesome. Body, right there. Xiphoid process, right there. All right, guys, remember, you also have the atlas. So obviously I want you guys to get this because I'm here for a reason. I'm here to guide you and to help you and to show you this so that it's not so confusing and whatever. Exactly. But you should have that Bible. Like if you're working off this without the Bible, I just said Bible, without the atlas or the textbook, it's going to be difficult. The body is, I would not call it the shaft, but technically that's right. No, the Bible, oh no, I'm not, no, I'm not upset about calling it the Bible, you're right, but I didn't call it the atlas, I called it the Bible. And people are going to be going to the Bible and saying, why am I reading this for the test? Slap you with the book, Diamond. Sorry, guys. We're all over the place, people. So it's okay. Shaft is we can consider it that, but only go with the terminology in the lab manual. All right, guys. Awesome. So I think we're good. Let's go. Now, here's a picture of the rib. You're going to see the rib in a second with our images, which honestly, it's a rib, people. It's a rib. So the rib does not look like the clavicle. Just FYI, guys. That's a clavicle, not a rib. Right? This is the rib. Nice and curved, okay? It has a head, which is near this area called the tubercle. Okay, the tubercle is a bump out part of the bone that sticks out, okay? It's like a process, but it's not. We call it a tubercle. And that's it. It's just called the tubercle. So if we're on the test, you get an image and what is this? What is the structure? You call it the tubercle, right? Why? Because that's what it says here, and that's fine. And the head is right by the tubercle. Okay, the head articulates with the vertebra. So this is the posterior. This is the anterior. This is going to have some costal cartilage. Okay. Bigger than a tuberosity. I don't know because when we get to the humerus, I don't know that it is. I don't know exactly. I almost feel like the tubercle is a little smaller. I feel like it goes tubercle, tuberosity, trochanter. I mean, it might be, but look at your images in Atlas and take a look. Tuberosity and tubercle are definitely of the similar size. Trochanter is like, it explodes. More elevated? Okay, all right. I buy it, but just take a look at it yourself. Compare and contrast. All right, awesome. Now, yeah. All right, no problem. Okay, guys, awesome. Now, here's the image. Why Kimberly Dutton? This is our image. So here, you can see really pretty tubercle, right, guys? Actually, go ahead and tell me where the tubercle is. I was going to circle it for you. Yeah, the bottom one shows it really nicely. The tubercle is by the head, right? And then, yep, there it is. So you you can see it. The bottom one's nicer, but the top one you can see it. And then the head is right by the tubercle. Awesome. And that's all they want, right? I lied. The shaft. But, okay, so that one's not, yeah. The shaft is the middle, right? The shaft is always going to be the middle of a bone. Like the shaft of the long bone is called the diaphysis, right, guys? That's it. That's the shaft. Just the middle. Perfect. That's it. Boom. We're done. Awesome. All right, now, costal cartilage. We did this again. We did this before. We talked about the true and false ribs, and that's it. You guys good? All right, awesome. Good. All right, awesome. Now, that's a clavicle. That's all I have to say because all it says is clavicles. So now, what do? We finished the thorax, which includes the sternum and the ribs, and now we're doing the shoulder. So let's kind of get moving. Not that I want to rush, but I really want to spend some time and slow down. We're going to spend some time on the vertebral column and on the hips. So if they point to the shaft, how do you know if that whole bone? Because they will ask, what bone is this? If they want the whole bone, or they'll ask, what structure is this? If they want the structure. That's right. Read the question. If they say bone, you got to give the bone. So it's a good question. So for example, if they give you this image and they say, what bone is this? You say the rib. If they give you this image and they point, now remember, they're going to point to something as well, right? Like, why would they point to the bone and say, what bone is this? It's the bone. They're going to have an arrow and say, what structure is this? Okay, guys, so watch that. Also, make sure you watch if the question says, where is this structure found, right? So if, say they give you simple squamous epithelial tissue, and they say, where is this found? Don't say simple squamous epithelial tissue. Say this is found in the lungs, right? So watch the questions. All right, awesome. That's it. Clavicle, yay. Now we're in the scapula. Still in the shoulder. All right, guys, are you ready? You must know your anterior and your posterior and your medial and your lateral. Okay. Wait, you're not ready? Are you messing with me? Austin, are they messing with me? What do I do? All right, so you got to know your anterior and your posterior and your medial and your lateral. J-Bon's like, I don't know. All right, guys, you got me? From here on out, you've got to know anterior, posterior, lateral, and medial. And that's because as we get into the different parts of the body, you have to know medial from lateral. Okay, that's exactly right. That's a good attitude. Maybe no, but we're going to have to say yes. So the first thing I want you to notice is the spine. That spine, and remember, guys, now this is not Blackboard. It's a black background, not a gray, but that's okay because we have the images and it's fine. So again, that spine is going to orient you immediately to the back. Why does that matter? Because what you're going to see is we've got something called, if you go down a little bit from the spine of the scapula, there's something called the infraspinous fossa and the supraspinous fossa. Infraspinous. Where do you think that would be? Infraspinous. Below the spine. Boom. That's it. Infraspinous means it's below the spine. Where's the spine? Here. Right? Now, this is a tilted forward picture, but where is the supraspinous? Supra, above the spine. That's not it, guys. That's not the supraspinous. No, come back. Whoa. That's not the supraspinous. We're coming to this guy in a second. If this is the spine, infraspinous is below, supraspinous is, there we go. That's what I want. Right now, it's a little bit hard to see, just a little bit peekaboo here. Now, let's go back to the spine. The spine goes up and goes into the acromion process, right? You can see it often in the front, in the anterior view, but it's actually in the back. It's the posterior view. Do you guys see what I just did there? You got to chunk this information together. You know that this is the scapula. So they're going to show me this picture if they're going to choose this and say, what bone is this? You're going to say scapula. If they put an arrow here, you're going to say spine of the scapula. Why? Because that's what's in the list, and that's what I'm going to grade you on. Okay, awesome. So, give me an X for the acromion process. That's it. Go up there. That's right. Follow the spine all the way up. Awesome. Now, for your information, well, just so that you know, although you're not going to be tested on this image, but this part here is called the glenoid cavity or the glenoid fossa. The head of the humerus sits here. Yep. So that's where the head of the humerus sits. That's the humerus. Awesome, guys. Good job. Now, anything else from the back? That's it from the back. So that's why you got to know, because you got to look at this and say, oh man, that's the scapula. Oh man, that's the spinous. Infraspinous fossa. Supraspinous fossa. Acromion. Boom. That's it. Right, guys? You got to chunk it together. Now we're going to go to the front, right? Well, this is just another image. Again, we're not going to get this one, but I just added it. Now, how do you know this is the front? Right off the bat, what do you not see? What do you not see? I do not see a spine. So with no spine, you say to yourself immediately, anterior, anterior, right? Why? Because the anterior has this lovely smooth area called the subscapular fossa. Scapular, scapula, fossa. Right, guys? So knock out the posterior one. The posterior one, spine, infraspinous fossa, supraspinous fossa, acromion process. Boom! That's the scapula and 4 of the markings, and you're done. No worries at all, right? You got to spell it right. And then you look at this and you say, oh man, there's no spine. That means this is not the back, it's the front. So this has to be what? And go ahead, guys, look at your list. It's fine. What does that area have to be? You know it's got to be a fossa, because the fossa is kind of flat and smooth. The elephant ear, that's right, that's exactly right. Subscapular fossa, exactly. Right? All right, awesome. Now, here, guys, is where you see that glenoid cavity. Again, head of the humerus fits nice. Since we have no spine, you can say to yourself, oh, that's got to be the coracoid process, not the coronoid. Remember, the pair of 2 little joint sticking out things on the mandible. The anterior one is called the coracoid process. Here, this is also called the coracoid process, right, guys? But it's on the scapula. So if you know the back, you know the front one has to be the coracoid process. Okay, guys? Supraspinous, supraspinous is the back. Did I say supraspinous? If I did, no. This is the front, so it's subscapularis. And then in the back, we have all the stuff we mentioned, and in the front we have the coracoid process. So front is subscapularis, front is coracoid process, front is glenoid cavity. Okay, guys? That's it. Boom. That's the scapula. That's it. Everything. Yep, exactly. Spine, spinous. That's exactly right. That's why you have infraspinous, supraspinous. And in the front, I don't know really honestly, because it's on the scapula for the subscapularis. And I'm calling it a subscapulaire fossa. Subscapular fossa. Yeah, so there's a supra and there's a infra for the back. There's both. All right, guys. So here is Blackboard. Now, very quickly, both of these images, are they anterior? Oh, it says it. Oh, forget it. I was like, what is it? It's like, it's labeled. Okay, but you don't see a spine, right? These here are not spines, okay? You don't see a spine, which means you know this is going to be anterior. So that's going to be the subscapular fossa. And then you know that that is going to be the coracoid process. And that area there, glenoid cavity or fossa, whatever you prefer. All right, guys? Yes, exactly. This is anterior. There's no spine. No spine, it's anterior. Who's going to call the ambulance when I die here? Okay, you're getting the first lab manual slap of the night. Exactly. You're like, wait till she does the hip and then let her go. You guys are brutal. So bad. You're like, don't get her yet. Exactly. After the hip, she's gone. Wait, guys, there's a second half of the semester. I don't know that my replacement's gonna be as good. No. All right, guys, let's go, weirdos. Come on. Okay. Yeah, exactly. After the final, just find out where I live. Don't do that. All right, guys, very quickly. What is this? Anterior or posterior? Yes. Where's the spine? Where is the spine? That's it. So, where is the, and I'm going to look at the words because apparently my mouth and my brain don't work. Okay, ready, guys? Where is infraspinous fossa? That's it. It's beneath the spine. Infraspinous fossa. Now, there's not a lot of this, but where is the supraspinous fossa? Supraspinous, exactly. Boom. Now, that spine goes up into something. What does that spine go up and become? What process is that? That's exactly right. What is that called? Look in your book, guys. No problem. What is that process called? It's called the acromion process because that spine goes up into the acromion process. That's right. Boom, boom, boom. That's what I want. Great. And where is the glenoid cavity or fossa? I like cavity. That's it. Glenoid cavity. Yep, that's it. Yep, that's it. Careful because there's a little peekaboo coracoid process in the front. That's the coracoid process that sticks out in the front. The glenoid cavity, which you got, is here. Right, guys? There and there. All right, you got it? Not bad. Not bad. All right, I like that. Good. Let's keep going because we still got to finish. Now, this is super janky, but they probably want you to know that that's the glenoid cavity, right? Based on this, it looks like that's probably the acromion process, and I'm guessing that that's the coracoid process, but I feel like that would be janky. I think they want you to know that that's the glenoid cavity. Wait, who's Kimberly? And why are you having a sit down? Oh, Kimberly! That's right. Miss Dunn. Now, it wasn't Miss Dunn's fault. They definitely told her what to do. You guys are throwing her under the bus. Not right. All right, guys, let's go. I was just so confused. But I've been saying her name for weeks. Like, you would think I would know. I would think so too, but we can't. Sorry, guys. Sorry, I got lots of love. That's right. Okay, let's do it. All right, let's do it, guys. Here we go. We're going to add some complexity. Now, this is the humerus. I want you to know anterior, posterior, medial, lateral. Now, this is me. How you do this is up to you, but this is me. I look at this, trochlea. That's what I see first because it sticks out very clearly. And that, to me, says anterior. Now, however you want to do it, it doesn't matter. As long as you look at this bone and you know humerus, which you should have known last week, and you look at this bone, figure out your landmark that makes sense to you. For me, this makes sense. Why? Because then I know this is the front, and this is called the coronoid process. Remember we have a coronoid process in the mandible? Well, meet your here, and I just said process. Coronoid fossa. We do have a coronoid process on the ulna, which actually goes into this fossa. So let me repeat that. This is my landmark to know that this humerus bone is anterior. It's called the trochlea, and again, labeled over here. This area that indents, like a little indentation, is called the coronoid fossa, okay? And then from there, I can start putting things together. Capitulum. And because this is a trochlea, I know that this is medial. So I'm going to call this medial epicondyle, lateral epicondyle. You guys with me? You see what I just did there? Establish anterior first. I know, I have to say it slow because my brain doesn't work as fast as my mouth does. It's a real problem. Anyway, so what we have here is the trochlea, which is anterior, the coronoid fossa, which is a little dip in the front, capitulum, and I know that this is going to be medial, so this is the medial epicondyle and the lateral epicondyle. You guys with me? Now, in the anterior, just like this image shows you, you can see the lesser tubercle, right guys, not a tuberosity, it's a tubercle here, and the greater tubercle here. You can't see that lesser tubercle on the posterior side. All right, guys, make sense? So we just covered in that whole little span, we just covered the greater tubercle of the humerus, lesser trochlea, capitulum, lateral medial epicondyle, coronoid fossa. That is all on the anterior. Okay? Now, I said it, but I didn't say it clearly. That's the head of the humerus. All right, guys, one more time that I want you guys to tell me. Trochlea, I know that's the anterior. Capitulum, coronoid fossa, medial epicondyle, because I know this is medial. Lateral epicondyle, lesser trochanter. Too fast. Lesser tubercle. Sorry, guys. Lesser tubercle, greater tubercle. And then we do have a deltoid tuberosity, which is kind of this bump out here, right? Yeah, that's it. The deltoid muscle attaches to that. All right, guys, you got me? Right? Awesome. Now, we're going to flip around. Now, here's Kimberly, okay? So, what do we see here? All of this is labeled, so that's kind of nice. But you got to be careful because, again, for me, that trochlea is like, that's what really sticks out to me. Lateral. Trochlea is always going to be closer to the medial. Capitulum is always going to be closer to the lateral. Make sense, Gloria? You see what I'm saying? So for me, that lateral, it means a lot. Because watch, this head of the humerus, you can kind of tell this is medial, but not really. Right? It doesn't have that nice kind of curve that you know is going to fit into the glenoid cavity. So for me, again, what works for you, but what works for me is that, and again, obviously this arrow is kind of covering it a bit, but this, I'm going to use red. That trochlea is like, it just sticks right out, like a big fat toe, right? And then I know that the medial epicondyle is here, capitulum here, lateral epicondyle, and then lesser trochanter, greater trochanter. Here's the medial tuberosity, which is here, but also a little bump out. And then, of course, coronoid fossa. Coronoid's in the front. See what I did there? Now, again, there's your trochlea sticking out. Capitulum, medial epicondyle, lateral epicondyle. You with me, guys? Whatever works for you. Did I call it a trochanter again? Lesser and greater? I called it a trochanter again? I need to just stare at it. I need to just stare at the words. Sorry, guys. Let me correct myself. And then, Tanya, you can ask the question. Okay. Not a trochanter. It is a tubercle. Wait. Yeah. Lesser tubercle. Greater tubercle. Tuberosity is deltoid tuberosity where the bone meets it. Yeah, exactly. I know that, but my brain and my mouth are not like wanting to come together on this. Yes, exactly. This is a tubercle. All right, Tanya, go for it.
So just to be clear, it's the medial epicondyle is medial because of where it is and as far as proximity to the trunk of the body, and then it's lateral epicondyle because it may be superior to the medial, but it's lateral on the humerus. Like, I'm just trying to get my brain.
Yes. So the problem with this image is that they're laying it down this way. And so the medial and the lateral absolutely have to do with the relationship to the body in anatomical position. So again, I'm orienting myself like this, trochlea. And I know that the medial epicondyle is close to the trochlea. I also know that this is the capitulum, and I know that this is the lateral epicondyle. So what this means is that this part of the head of the humerus is going to go into the glenoid cavity of the scapula. That's my janky scapula right there, okay? That means that this is the medial part of the body, and this is the lateral part of the body. And based on this image, knowing that this is anterior, this is the right humerus. It's like you lying down and looking at your right side. That's the image you have right there. You're going to be lying down and looking at your right side. Does that make sense?
Yes.
Okay, so you're correct, in other words. All right, awesome. All right, guys, so did you guys see what I did there outside of that? And I'm staring at it now. I'm just going to stare at it. Tubercle. Find your landmarks. Whatever you like. You might not like that. Other people see different things. Some people see knuckles. Some people see other things. It doesn't matter what you see, as long as when you see it, you orient yourself anterior, and then obviously conversely posterior, and then you got to know the rest of the bone markings that we just talked about. But do them together. All right, awesome. So this is going to be the humerus still, and it's posterior. Now, notice that there's a little peekaboo trochlea there, but it's nothing like this. It's nothing like this big trochlea sticking out. So you shouldn't get confused by that, okay? It's just big enough that you can see it. But what you can see as well is this really big fossa. That fossa is called the olecranon fossa, and it's big. So that olecranon fossa is my marker for posterior. And then, because I know that this is a little peekaboo trochlea, I know that this is medial epicondyle. I know that this is lateral epicondyle. This is the humerus, that's the greater tubercle. However, you cannot see the lesser tubercle on this image. Why? Because it's pretty solidly in the medial part of the head, anterior, on the front of the bone. All right, guys, you with me? And then, let's see. And then the deltoid tuberosity, again, is that bump out. Yeah, that's exactly right. So left. No, because this is your right. This is medial. In the back, posterior, it's the same orientation as you. In the front, it's the opposite. Awesome. All right, guys, that makes sense to you guys? And so what we just found was the all we needed to finish the humerus was the olecranon fossa, which again, you must be in the back to see. That's the olecranon fossa there. And then that's it. Because we can see everything from the front as well. And the deltoid tuberosity is kind of this area, bump out. All right, guys? That's it. So not bad, right? You see what we did there? You got to find your anterior, posterior, medial, lateral, and boom, boom, boom. And that's it. So it's not bad. But that's what you got to do. All right, awesome. Now, again, here's Kimberly. What do you see? Again, it's what you see. Look at the images and immediately associate what you see. What I see, a massive fossa. You see that fossa? I'm going to compare it. Let's compare it to the anterior. This is the anterior view. You see that fossa? It's small comparatively, right? And of course, I see the trochlea. That's what I see. But when we're talking about the fossa, that fossa here on the anterior part, the coronoid fossa here, is going to be completely, I mean, it's smaller comparatively. Okay? All right, and remember, coronoid, not coracoid. So here, what I see, boom, is a really big olecranon fossa. And that should tell you immediately posterior. Of course, you have to know it's a humerus. We're assuming you know that, right? Hold on, guys, I got a cough. Hey, if you see a spoon, awesome. Whatever you see, you could see another dragon. As long as when you look at it, you take that immediate visual image and you associate that with the bone, obviously, and then the front or back. And then very quickly, you associate it with medial and lateral. Now, the nice thing is that trochlea keeps popping up everywhere. And that trochlea is your key to medial, right? So, look, I'm posterior. That's medial epicondyle. The opposite is lateral, right? Look, fossa, little bump out trochlea. We know that's medial epicondyle, lateral epicondyle. You got me? Now, greater tubercle, but you can't see the lesser tubercle here. All right, sweet. So you see what I'm saying? That's the kind of way that you need to approach this. And again, it's really whatever you see. When I see this image, that's what sticks out to me. So whatever you see that sticks out to you, use that to associate. Just make sure that you get your medial, obviously, associate that with posterior or anterior. This is posterior. And here, I'm going to associate that very quickly with medial. And then the opposite is lateral, right? Once you know medial, you got to know lateral. It's the opposite. All right, guys, that's it. That's what I'm talking about here. So now, this is not bad because what do I see? I see a lot of bumps. Bumpy, 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 smooth. You see what I'm saying, guys? So I really want you to think like that. What do you see? And make sure that you're comparing these things together so you're like, okay, I know this is the head of the humerus, and I know that this is anterior because I have these really this bump out. Obviously, this is going to be the lesser tubercle and the greater tubercle based on what we talked about. You can't see anything here, but you can see this rough area, which is the greater tubercle. Now, obviously, they're both the head of the humerus. Okay? And I didn't talk about they don't want the neck, so we're fine. All right, guys, you got it? That's it. Not bad. All right, ulna and radius. Let's move. Now, here's the ulna and the radius. First of all, radius looks like the head of a nail. But whatever it looks like to you, do it, right? I don't know what it looks like to you, but it looks like the head of the nail. This one, now, this is not the image on Blackboard. The image on Blackboard is actually much nicer. But I do have a little fossa, and I've got a couple processes sticking out on the ulna, okay? Now, we also have a couple things here with the radius. There's the head, the neck, right? And then we have another what? We have another tuberosity, right? Notice the tuberosities. We've got the tuberosity on the rib. We've got the deltoid tuberosity on the humerus. And here we've got our other tuberosity, the little one sticking out here on the radius. Radial tuberosity. Okay, guys? Not a tubercle. Tubercle is going to be those bump outs on the head of the humerus. Okay? And definitely not a trochanter yet. All right. And then let's see. Styloid process. Now, both the radius and the ulna have a styloid process. You can't see it here. That's okay because you're going to see a different image. You see this little thing right there? You know your styloid that you write on your iPad or whatever on, whatever, the little pen that doesn't have a pen? That's what this kind of looks like, the styloid process. Now, you have a styloid process on the temporal bone, so watch that, guys, okay? Are we all good with that? So, that's it. Head of the radius, neck of the radius, radial tuberosity, styloid process, boom. All right, ulna, olecranon process, coronoid process. This is called the olecranon, wait, hold on. Wait. I should just look. I don't know why I'm not looking at it. Trochlear notch. Whoa, I had another brain fart. Trochlear notch. Remember the trochlea? That funky thing that looks like a toe sticking out that we talked about? It goes in here. So that trochlear notch is going to actually sit in here. The olecranon process is going to go into the olecranon fossa of the humerus. The coronoid process of the ulna is going to go into the coronoid fossa of the humerus. Boom. Okay, guys? Now, there's no tuberosity on the ulna, but we do have a styloid process. Let's go look at it. All right, here is Kimberly. Now, again, what do you see? Looks like the head of a nail. That's the radius. That's the head. That's the neck. That's the radial tuberosity, a little bump out. Pretty styloid process. Now, also has a styloid process here on the, it's the same bone. Whatever. But here's the tubercle on this side. All right, guys, you with me? That's it. Not that bad, right? Now, of course, you cannot start these bones, the bone markings until you learn the bones, so I hope you've already done that. All right, so here's the ulna. Now, this ulna is really pretty, okay? Why? Because it has all the parts that are going to articulate with the humerus, right? With the distal part of the humerus. Yeah, isn't it pretty? Okay, why is it pretty? Olecranon process, trochlear notch, coronoid process. Again, all labeled here. And then here's that little part, the styloid process. Nice, isn't it? Awesome. Right? Now, guess what? There are three of these markings are the opposite of the humerus. The humerus has the olecranon fossa and the coronoid fossa and the trochlea, right? And this ulna has the olecranon process, the coronoid process, and the trochlear notch. So it's not the trochlea notch, it's the trochlear notch. All right, guys? Not bad, right? We're getting a couple two for us here. Just know where your fossa and your process is. And don't mix up the coronoid and the coracoid. The coracoid process is on the scapula. The coronoid process is on two places. It's on the mandible and it's on the ulna, which you can see here. All right, you with me? Not bad, not bad. All right, carpus and hand. Now, we went over this already when we did the bones. So I'm just going to ask you a quick question. Well, first of all, the bottom line is you've got to know the thumb, the hallux, right? The pollex. Sorry, guys. You got to know the thumb because everything goes from the thumb, right? Obviously, the numbers, because here the numbers start 1, 2, 3, right? 4, 5, and then the same numbers at the metacarpal. 1, and I'm just going to use Arabic numbers. 1, 2, 3, 4, 5. So you got to know your thumb. That's where everything starts, right? And yes, you have to know the bone numbers. People, there are 14 finger bones. How do I know which bone if I don't say the third distal phalanges? How? You do not know. So, and how do I know which metacarpal bone? There are 5 of them. You need to have the bones. All right. Now, with that being said, once you orient around the thumb, this is the thumb and this is the metacarpal number 1, right? Once you orient around that, then you got to think the 4 rows. The 2 rows of proximal and distal bones of the wrist, right? The first 4 proximal are scaphoid, lunate, triquetrum is underneath the pisiform, and then back to the metacarpal and thumb, right? Then you go trapezium, trapezoid, capitate, and then hamate, right? Even if you flip it over, you still know where because you start from the thumb, proximal row, and then distal row. Does that make sense, guys? But of course, you're going to use the Blackboard image. That's it. Boom. We're done. All right. Wait. Did I miss anything? Yeah, I just went over all of it. All right. Very quickly. Where is the trapezoid? Remember, it's in order. This is going to be, that's trapezium. Go over just 1. Yes. Got to go over just 1. That's right. Because it goes trapezium, trapezoid. All right. Awesome. Now, where is this one's kind of easy, this image especially, pisiform. Where's the pisiform? Go over, that's it. It actually sits on top of the triquetrum. The hamate articulates with 4 and 5. Yeah, it does. That's right. Yup. It's got the hook. It's got that hook. All right. Tell me, where is the third proximal phalanges? That's it. Got to go up. Watch that carpal. That's it right there. Perfect. Oh, someone gave me the third carpal. Don't give me the carpal. Give me the phalanges. Awesome. Good job, guys. That's it. All right. Good job. Now, all right. I want to take a break, but we can't. Sorry, guys. We've got to get through this. We almost because people are going to get full credit, but then again, I don't think we can get Roman numerals. So you can get Roman numerals on laptop, right, guys? It's just a capital I and a capital V. So the capital, yeah, exactly. So you just put capital I. Are you Canadian? Okay. See, us Canadians have to stick together. So anyway, yes, you can do the Roman numerals, but you have to put numbers for the low P people. All right, now. Let's do this, okay? Let's do this. Okay, shake it off. Shake it off. Listen, okay? Just listen. Now, these images are clearly Blackboard. You gotta orient yourself, okay? This is the right and left hip separated, okay? So I want to orient you. Obviously, they're labeled, but forget about the labels for a second, okay? Watch. First of all, this is the pubic bone, okay? That's great. This is the ilium, okay? That's great. It's like roughly there, roughly. The top obviously is the ilium, right? Okay, that's great. The back, which is tricky in this view, so we don't have to worry about it so much, the back is going to be the ischium, right? It's kind of back here. Now, we don't have to worry about so much about that. Not right now. Although we do have an ischial, but don't worry about that, right? What I want you to notice is the ilium and the posterior part of the ilium. Watch. See all this rough stuff here? Rough, rigid, all there. It's not smooth like here, the fossa. This is posterior. And this rough part here is going to orient you to posterior because the sacrum articulates here with the hip at this rough area, which we're going to see in a little bit. It's called the sacroiliac joint, and that's actually in here. But the point for this part is to know that this is posterior, right? You can see that rough part, okay? And then this is going to be anterior. Now, once you know, but honestly, that pubic bone being anterior is not as helpful as this rough part being posterior, because if you look at your book, page 75, and we're now on the os coxa column, the bone. The first one is the ilium, which that's where we are, the top part. We have to know the anterior superior iliac spine and the anterior inferior iliac spine. Iliac is associated obviously with the ilium, right? But I want you to know that this being posterior means that this is anterior. Are you guys following me? When you do that, things start to fall into place. Okay, guys? So, anterior superior iliac spine, this. Anterior inferior iliac spine, this. Okay, guys? See what I just did there? Anterior superior iliac spine, this. And it's a little bit less pronounced here. Anterior inferior iliac spine, right? But how do you know? You start with posterior. You guys get me? Once you get that, and again, that for me is easy. Obviously, you can see the pubic bone there. That's fine. But once you see that on the ilium, then you'll be able to see the anterior on the ilium, right? And that's the superior, inferior, anterior, superior, inferior iliac spine, anterior, superior iliac spine, anterior, inferior iliac spine. Yes, that's exactly right. Because the way this is it's shown, my hands are the back, right? My hands, the back of my wrist is the back. And then my fingers are the front. It tips sideways and it does this. So the posterior is at my wrist, and then the anterior is going to be my fingers in this image. And then they turn it this way to the side. I don't know if that was at all helpful. Risa was like, that didn't get it. Okay. I was like, I don't know, I tried. Right, guys? But really, this is what you got to know. Posterior. This is the ilium, of course, right? I mean, you got to know this is the ilium, right? That came from the bones. So, posterior ilium, and then that's the anterior spine. That's the superior. That's the inferior. Right, guys? And then, what else do we have? Then we have the iliac crest and fossa. So iliac crest, it depends on where they do it, but basically it's the whole thing, right? The top is the iliac crest. Just be careful, because sometimes they go a little, like they come to the front a little bit. I know, but remember that it's a weird turning thing, like it's like a weird bowl that kind of turns. Yeah, I know, it's weird. So that's why you're like, wait a minute, she told me this is anterior, and then she's telling me this is anterior. It is because it sits open like that. It's actually not open, it has to come back. So that's why it's weird. That's why you kind of got to trust me on this one. Yeah, exactly. That's exactly right. We flattened it when it shouldn't be flattened. It should be more in a curved way, where the curve of this meets the curve of this kind of a little bit skewed. And this goes right to the back. So it's curved and flattened, which is more confusing. All right, with that being said, when you know that this is posterior, then you know the sciatic notch is in the back. And again, a notch is just an indentation, right? Sciatic notch is where the sciatic nerve goes, and it's big. And then you're going to go down to the ilium. So remember, you know your bone, so you know that this is I said ilium, the ischium. So the ischium is going to be down here in the back. And this thing that's sticking out is called the ischial spine, right? Iliac, ilium, ischial, ischium, right? The bone is the ischium, the bone is the ilium, the bone is the pubic bone, the hip is made of 3 bones, right? Iliac is associated with the ilium, ischial is associated with the ischium, right, guys? And then here, this bump out is called the ischial spine, right? We got an iliac spine, superior, inferior. We've got an ischial spine. You guys got it? So it's not bad if you orient yourself. Posterior, gotta know your ilium. Here is the sciatic notch. Here's the spine on that's the iliac spine. And then we've got the, hold on guys. And then we've got the ischial spine. All these are the ones that stick out. Yeah, it's a little better, I think. So again, spine, 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 spine. Notch. Okay. Posterior. Let me change that. Posterior. Anterior. How's that, guys? You gotta orient yourself. Okay? And again, anterior superior means from the front and on the top. All right, I hope that's not bad. I hope it's not bad. And then, again, iliac fossa, honestly, boom, 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 no problem. Reminds you of something? Subscapular fossa, right? Right? Nice, flat, smooth area. Not all fossas look like the olecranon fossa, this big dip, right? Or the coronoid fossa, which is also like a dimple. This is more like a flat, kind of open area, right? But this is a fossa. And this one is going to be the iliac fossa. Shocking no one, because guess what? That's the ilium. Right, guys? Got it? See where we're going with that? Not bad. Know your ilium from iliac, know your ischium from your ilium. Know your posterior from your anterior. That big notch here is actually the greater sciatic notch. This little one is the lesser sciatic notch, but you don't have to know it. All right, guys. And the greater sciatic notch is part of the ischium. Okay? So where would the crest be? So the crest is up top, but sometimes they show it like at the front a little bit more. Just be careful not to at the bump out. Yeah, but let me see if I have a better image. Hold on. So here you can see from the front, the iliac crest is like the very top. But that's not the best one. It would be more here, actually. The very top part. It's like the top of the wave. Ramus. Yes, we're going to get to that. Hold on. There's no ilium ramus. So we're going to get, in this image, it's hard to see, but this is the pubic ramus. But I want to give you a better image. This is the image. So first of all, iliac crest is the top of the ilium, right? The crest of the ilium, the top of it. You can feel your iliac crest. If you push down on your hips, you can feel the iliac crest. Just FYI. And then here you can see the iliac fossa from here. Now, this one is obviously the complete hip together. And here, remember that a ramus is like a handle, right? Like a bar. It's like a bar. And so here, that's the pubic ramus. That's also the pubic ramus, or the ramus of pubis. And then here, this area here, that is going to be the ischial ramus, right? Because the ischium is like about here. So the ischium is about here. It's half of the acetabulum and the back of this. This is all the ischium here. So this is the ramus of the pubis. This is also the ramus of the pubis. This is the ischial ramus. That makes sense, guys? All right. And then the ischial tuberosity, it looks better in another image, but you can it's a little bit more posterior to this. And then, of course, the pubic symphysis is the cartilage, right? It's the fibrocartilage in between the pubic bone. Right, guys? Pubic bone, pubic symphysis. Not the bone. The pubic symphysis is this area here in the middle. Okay? All right. And I'm going to give you a better image. Oh, and again, you can see that we're kind of repeating some of this. So we already did, what did we do? We did the ischial tuberosity. It's down here, but it's better. The tuberosity is going to be, it's going to be an area where it's really rough. So you can kind of see it here, but you can see it in the next image better. The ischial spine, you saw it in the other image, right, that we saw. You can't see the ischial spine here because it's posterior. Wait. Yeah, it's posterior. So you can't see it here. And The ramus, the pubic ramus is here and here. All right. Now, here again, Kimberly Dutton. Here is the acetabulum, guys. The demarcation is roughly like this, with the ilium being this part here. This is the ilium. And this part here, where am I? Where's my pubic bone? The pubic bone you can't see because this is posterior. And this, and this from here, that's the pubic bone in the front. This part here, in the back and half of the acetabulum, that's the ischium. So here is where you can see the ischial tuberosity. All right, this one here. You can see the pubic symphysis. You mean like the little peekaboo thing here? Yes. Yeah, so the pubic symphysis, though, we normally think about the pubic symphysis as that gelatinous part in the middle. So the pubic bone is going to be right beside the pubic symphysis. But you can see the pubic, the ramus. The ramus is here. That's the pubic ramus. Because this is the ischial ramus. Do you guys see the difference? And that's where you got to be careful, because that whole bone, I'm not sure I understand what a ramus. A ramus, literally think of a ramus like a bar. It's just an area of the bone that you can grab. You see that, like, you could grab that and you could grab this. And that's it. It's an area of the bone that you can kind of grab. It's almost like a shaft. It would be like what looks like a shaft. It's just the area that you can grab, like this. That's the pubic symphysis. You can grab that, and that's the ramus of the ischium. Does that make sense, guys? Yeah, like a handle. Yeah, that's exactly right, like a handle. Yeah, if that works, go for it. Or a purse. I don't know. Now you guys are thinking differently. But does that make sense, guys? So, orienting yourself very quickly, that's the pubic bone. Not the pubic bone. That's the sacrum. That's the coccyx. That joint right there, sacroiliac joint or sacroiliac joint. More like a headache. Yeah. But, guys, you can grab that with your hand like a bar. That's the pubic ramus. Or here, it just calls it the ramus. And then here, that is going to be on the ilium. And that you can grab like a bar. And that's called the ramus as well, the ischial ramus. Well, they just call it the ramus. All right. So that's, and also, guys, just so that you guys see, greater sciatic notch, right there. Ischial spine, right there. You see? And again, acetabulum. That's the next part. Obturator foramen. That. And peekaboo. Obturator foramen is here. It's the hole. This part here where I've covered it is the acetabulum, where the head of the femur sits. The hole is between the ramus. Between the ramus of, the ramus surround the obturator foramen. You have muscles that go through there. Pubic angle, very good. This, you guys see that? If it's smaller, if it looks like it's remember this is a 90-degree angle, right? It's a right angle. It just means that this would be like kind of turned that way, right? And yeah, it would be male if it's smaller, and anything that's bigger than 90 degrees, again, here's 90, turn it sideways, and if it's bigger, then that's going to be the female pelvis or hip, because it's bigger. Females have to give birth. All right, awesome. Make sense, guys? All right, so again, here you can see that sciatic nerve, that's the ischial spine, that's the tuberosity here, the rough part here, a little bit sticking out. That's the ramus of the ilium, that's the ramus of the pubic bone here at this angle, that's the acetabulum. This part here is called the obturator foramen, big pole there. Your femur does not go here, it goes here, the head of the femur goes here. This is the sacroiliac joint, because that's the ilium, and that's the sacrum. Yeah, whatever that was, awesome. Socket, yeah, exactly. This is analogous to the glenoid cavity in the scapula, where the head of the humerus goes. Yep. So the ischial ramus is going to be here. Imagine if I went inside the ramus and accidentally went through. What? Ew! You mean the head of the femur? Ew, that would be bad. But it wouldn't happen because you have so many ligaments there. You basically have to rip it off. You have to be eaten by a zombie. I don't know. With the way the world's going, it might happen. The zombie apocalypse. Protect your femur. Sorry. All right. Anyway, that's it. So it's not bad. Just okay. This is what you want to do. You want to print out the images. You want to circle these areas, right? You want to circle. You want to establish your posterior and your anterior, and then circle stuff, right? This is going to be the iliac fossa, the iliac crest. Here you've got some spines. Circle all the spines. Circle all the spines, and then label them, right? All right. You guys are so weird. All right, pubis. We kind of did everything already, but okay. Same image. Sorry, guys, I just repeated everything. So the pubic symphysis, remember, is between the pubic bone. Pubic bone goes here, and the pubic ramus is here because the pubic bone goes down a little bit. Now, this is also the pubic ramus, guys, right? Goes up a little bit, too. And I think everything else we've covered. Okay? All right. And again, here's another image. Acetabulum. The obturator foramen. This is the back, right? Sacrum. So here is this is a good example over here. Maybe I'm making it too big, but this area is going to be the ischial, spine. No, I'm sorry, that's not. The ischial tuberosity. Sorry, ischial tuberosity, because that's the posterior. Thank you. So is the foramen? Yeah, the foramen is just a hole. You see where it's just a hole, guys. That's the hole. Yep. Remember, foramen means hole. Just like we have I gotta look because my brain is melted right now. In the occipital bone, we have the magnum foramen. Yeah, no, it's okay. I mean, Whew. So this is just the hole, and this is the obturator foramen. This is the actual indentation or socket, and this is the acetabulum. And that's the back, so that's posterior. This is the sacroiliac joint right here, where the posterior part of the ilium is going to articulate with the medial. So the lateral part of the posterior and medial part of the hip, the ilium, is going to articulate with the lateral part of the sacrum. Yeah, exactly. Yeah, that's right. You sit back here. Yep. Awesome. All right. Oh, all right. And here, again, just kind of giving you a full thing. There's the sacroiliac joint. There's the ilium. There's the crest. There's the fossa. There's the ramus there's the pubic ramus. There's the ischial ramus. There's right there is the acetabulum. That's the obturator foramen. Here, anterior. Here's your spines. Here's your spines. You can't see the ischial spine here. It's in the back. You can't see the greater sciatic notch. It's in the back. This image is on my back. I know. But you gotta know the other ones. I know. The other ones are okay. You just gotta know them. All right. Femur. So, anterior, posterior. So I want to go to posterior first. When I look at this, obviously the trochanter sticks out, right? So know that the humerus does not have a trochanter. They don't have these massive bulging things at the feet, at the head, right? The lesser and greater tubercle of the humerus are much smaller, and they're right on the head, right? You can see these, like, it looks like almost like a like a walking stick with this massive part sticking out there. It's a trochanter. Tanya, I got it. That's not nice. You guys are mean. Wait, why a cookie? Is that for me? I do want a cookie. I do want a cookie, but I have no cookies. So, oh, a treat? Do I get a treat? Or does Tanya get the treat? Tanya gets the treat because I suck. I get it. So, although yes, that's kind of your landmark. My landmark for the back of the femur is actually the condyles. So, even though obviously these trochanters are massive, my landmark for the posterior femur are these things that stick out. Now, we talked about the humerus having an epicondyle. The femur has both a condyle and an epicondyle. So don't forget that, right? Now, what would I do? I would look at this and say, condyles, they're really big and they're sticking out. So I'm going to say posterior. That way you can figure out very quickly, okay, I've got the greater trochanter, lesser trochanter, head of the humerus, and that head is so obviously medial that I would say medial epicondyle, condyle, lateral condyle. All right, does that make sense, guys? So again, you gotta know your lateral and medial because we've got lateral and medial condyles and lateral and medial epicondyles. So technically, you can see the lateral and medial epicondyle too. This is the medial condyle. This is the lateral condyle. How do I know? This is medial, right? And then if you go up a little bit, that's going to be the medial epicondyle. And a little bit up is going to be the lateral epicondyle. Okay? And then in the back, you have something called and actually, wait, I'm going to make sure that, yes, you should have that linea aspera. You see this line there? Very clear line. And that is what we call the linea aspera, and it's in the back right there. It's like kind of right in the, it's right on the shaft. Right on the shaft. But you see it in the posterior. Just like we saw the deltoid tuberosity on the anterior, although you can't see the deltoid tuberosity, you can see the deltoid tuberosity on the side. All right, and then what else am I missing? Obviously, I'm missing stuff. Don't worry. Head and neck, right? And gluteal tuberosity. Now, you got to be on the back to get your gluteal tuberosity, right? Because it's the gluteus maximus, and it's up here. It's up here. That's the gluteal tuberosity. But you're not going to get the gluteal tuberosity in the front because it's in the butt, right? Yeah, not the deltoid. Deltoid is humerus because your shoulder. These muscles that allow you to move your shoulder are called the deltoid muscles. The gluteal muscles are your butt muscles. You got middle, gluteus maximus, medius, and then one more, but we don't talk about it. Anywho, that's what it is. Oh, did I say the deltoid? I hope not. I thought I saw the gluteal. The linea aspera, yes, the linea aspera is going to be in the back. And you can really see that. That's really, well, not bad. There we go. Oh, I hope I didn't say the deltoid. That would have sucked. That is the gluteal, that's going to be the gluteal tuberosity. Okay, so not the tubercle, not the trochanter, tuberosity. And we saw so far we have a tuberosity in the rib. We have a tuberosity in the deltoid tuberosity, which is in the humerus. And then we have the radial tuberosity. All right, awesome. And this has a gluteal tuberosity. So now you're starting to see that, except for the fact that I keep calling a tubercle a flippin' trochanter, you can see that you can kind of make a little bit more sense out of those words. They're just there. This is posterior. This is posterior. This is anterior. Yes. Just ignore that one for now. All right. So with that being said, let's go back up to the anterior, then we'll do the other one. No problem. All right. And again, that's why you got to know anterior, posterior. Because once you got that, everything else falls into place, roughly. So again, what do you see here? You don't see those massive condyles, right? You don't. So you're not going to do the condyle from the front. You're going to do the condyle from the back. Usually they're going to do the epicondyle from the front. So now I still want to establish medial. The head is medial. It's very clearly medial. You got to have a big one because this bone is big. And so, yeah, you have a clear medial head of the femur. And then that means this is the medial part, which is the epicondyle. Lateral epicondyle. You guys see that? And again, you can see a little bump out lesser trochanter, but we're going to ask from the front, right? From the back. It makes sense. All right, guys. Does that make sense? That's it. That's the femur. Not bad, huh? Oh, yeah, Brisa, you're right. It's just to show orientation, which is confusing in itself. All right, guys. So here we go. We just did this one. Now let's go ahead and do Kimberly. All right. So again, for me, look at the condyle here, guys. Boom. No clear condyle there, right? So you know you're posterior, which means I'm going to make sure I get my medial part, because that's medial condyle, lateral condyle. Now, you can be asked about the epicondyle in the back. That's okay. It's just above the condyle, right? And in the front, the anterior, there's your lateral epicondyle. That's medial, right? And then that's your medial epicondyle. Linea aspera. Wow. I don't even know what just happened with my with my speech. I tried to get deltoid tuberosity out and it didn't happen. Deltoid tuberosity, lesser trochanter, greater trochanter in the top. What am I missing? I think that's it. I didn't say deltoid. Oh yeah, we can't see the fovea cap. Did I say deltoid? No, I didn't. Did I say deltoid? Oh, gluteal tuberosity. Oh no. No, we can't take a break. 10 extra points for saying it correctly. I know, we need to take a break. But guys, we can't because it's 7:37. I know, Jensen. Jensen's been begging for a break for an hour. Okay, I'll give you a break 5 minutes. Come back in 5 minutes. Go. I'm not going anywhere. Where's the gluteal tuberosity? Tanya, are you messing with me? The gluteal tuberosity is right there. Everyone was yelling at me because I called it the delta tuberosity. Okay, 5 minutes, go. Come back at 7:43 exactly. But I'm not going anywhere because if I leave, I won't come back. I won't be able to find my way back. Even though I'm in my living room. I have to stay. Oh, I'm sorry, Jensen. I'm surprised you made it this long. This is crazy. Not you, but just this class. Go for it, Gloria.
It's actually not a question. This is the first time I actually submitted any of my slides for review. So okay. How is it that we see our review?
Oh, yeah. So basically what you do is tomorrow, because I haven't actually given it to you, you just go back and you look, you can click on the assignment and then it'll have like its student comment, like if there's a comment section. So you go back into the assignment and then, now you'll get a 0, but that's because I have to put something in there. So the number value doesn't matter. It's just I have to put something in there. So you'll be able to get you just gonna want to look at the comments when you go in there.
Okay. And then the other thing was when you look at one of, what was it, the smooth muscle? It was a smooth muscle. I actually had to like outline the cell because of course it's a funky like cell. So I had to like draw it with the little, and it didn't, like when I uploaded it to Blackboard, it didn't go on there. And I looked at it today and I was like, it's not even there. She's gonna think I'm slow.
No. Please, how long have I been calling this thing here the deltoid tuberosity? Anyway, so don't worry about that, because honestly, you didn't have to do that because you can't actually see the cell membrane. So in class, what we talked about was just put an arrow to like the pink part near the nucleus, and then just call that the cell, because there's nothing else you can do, right? Now, some people were able to they did the outline like you said that you tried to, that didn't upload, but it ultimately doesn't matter, because you won't get that outline on the test. You'll just have to know that it's smooth muscle and that we're not pointing at the nucleus. And then you'll say, oh, it's the smooth muscle cell.
Gotcha. Okay, thank you.
No problem. All right, guys, if you have any questions, let me know. Sorry, the deadline was Wednesday. Sorry, guys. I'm so sorry, Jensen. And I totally acknowledge that I was dragging you people through this. Like, it's not you. And I'm so sorry. And I know I was doing it. So thank you for that. It's important. It's just
it's fine. It's fine.
Like, no, and I do appreciate it. I do.
The first time when we started going over the bone markings and we didn't take that break, I basically had a mental breakdown because
I'm so sorry.
It's fine. It's fine. It's all new. That's why.
I know. I know. And you're not wrong. You're right. And like my Tuesday class, I'm not proud of that. Like, but I knew I was doing it, so I'm very sorry. But I knew I was doing it. I was dragging you guys. I was.
I've been trying to get better, but like after a few hours, like if I'm constantly sitting in one place, my ADHD will kick in and it'll be irritating sometimes.
I understand, and it's harder on you because you have to deal with a biochemical issue that makes it harder. This is hard on everybody. Like, everybody was like, trust me, everybody was like, yeah, take a break. Everybody needed a break. And I feel bad. Because I know that, because we got to get through the material. So, but yes.
I know. I understand. Yeah. I understand why you don't take breaks.
And normally I do. Normally I want to take a break. It's just today's Friday and you got to test this week.
Yeah.
But no, normally I do want to take a break. So it's just today's one of those days. But thank you. I appreciate it. I do. All right. I know. That is crazy. Oh, an exercise ball, Melinda. That's a great idea. It keeps you kind of like moving, but you still have to use your core so you don't fall over like I would. But see, I would fall over, which would be hilarious for you guys. Not so much for me. So it's great. I don't have enough core strength for that thing. All right, guys. Thank you for really encouraging the break. I'm sorry about that, guys. Really. I know I'm dragging you through this, and it's not ideal, but also what's not ideal is not getting you, you know what I mean? Not giving you the information you need. So I'm picking the lesser of the evils. All right, awesome. Yeah, I'd stop paying attention. All right, guys, awesome. So this is the gluteal tuberosity. I don't know what happened to me. All right, awesome. Everything should be good in terms of what we have here. So again, anterior, posterior, get your medial and lateral, because the femur has the medial and lateral condyle, and then the medial and lateral epicondyle. Oh yeah, we're coming to that. Jennifer's like, where's the fovea capitis? It should be right. Hold on. There. That's it. It's like literally the dimple. It's just you can't see it in any other image. Sorry. I don't know why it's so funny. Yeah, you got it. Woo, that's it. Beautiful. Yeah. Phobia cabbages. But you can't see it in another image. Just for kicks, greater trochanter, lesser trochanter. And just thinking about something. Whether or not you can see the deltoid, gluteal tuberosity. Here it is. Gluteal tuberosity. And then the linea aspera. And again, back, posterior. I know, no deltoid. Bad teacher. I know. But I didn't say it. I didn't. I said it wasn't the deltoid. I didn't. I said it was the gluteal tuberosity. All right. Yeah, that's it. Oh man, that's not okay. That's not okay. I'm working really hard. All right, guys. Awesome. Yeah, it is. And you can see it. I mean, obviously you can see it, but you can see it really well here. That's why you can see it on the posterior. And just like the gluteal tuberosity. Yeah, I don't know why my head is right on that deltoid tuberosity. It's weird. It's really annoying now to me. It's annoying to you guys, but now it's really annoying to me because in my head, I'm just like, 88, please. Yes. Okay. So again, take a screen grab, no problem. And that way you can review. But got to get your anterior, posterior fast. And like I said, I'm all about this condyle. Or if or again, the trochanters are quite massive. So, the big ones. All right, awesome. That's it. So now we're on the tibia and the fibula. Now, guys, this is not the humerus. Okay? Because there's no head of the tibia. The tibia has no head. It's kind of flat. It's more flat because it articulates with that condyle, those condyles, lateral and medial, on the femur, right? And here, this is going to be the anterior. Now, it's good because actually I don't think we even have a posterior image here because there's nothing on the posterior. So, but just to stick with our kind of methodology, the anterior part is this tibial tuberosity. It's a very clear bump that you see here. So this is not like a tubercle or a trochanter. This is the tuberosity. So that's going to be different here. However, although we don't have a head of the tibia, we do still have condyles. Now, let's put something into perspective. Humerus, it has the lateral and medial epicondyle, okay? Femur has both lateral and medial epicondyle and condyle. Now, the tibia just has the condyle. So you guys see how that kind of the pattern went? Epicondyle, condyle. So think about it, stuff like that. Wherever you can, kind of bring things together and connect things and compare and contrast. So here, again, how do we know this is anterior? Is because of this tibial tuberosity. It is because of it. Because apparently I don't like the letter T. It's because, exactly. So wherever you can see that, obviously recognizing these things as we're looking at the bones is really important because you want to have that instant recognition. And whatever sticks out to your eye, that's what you want to recognize. But again, here, like you just said with the pattern, it goes humerus, epicondyle. Obviously, there's medial and lateral for both. Femur, epicondyle, condyle. Tibia, condyle. There we go. And that way, that's good to have in your head. So if you're trying to remember, wait a minute, is this the humerus? Does it have a condyle or does it have the epicondyle? You remember that pattern, okay? So here, you got to know anterior. Although, like I said, I'm pretty sure we don't even have the posterior for this image. And then, watch, guys. This is not a great image because I think I covered part of it with my little arrow. This part here is the malleolus, not the styloid process. Listen. The styloid process is in the ulna and the radius. So we have a radial styloid process, but we just call it the styloid process here for the radius and the ulna. For here, the tibia, that's not a styloid process. It's a malleolus. It's the medial malleolus. It's your ankle bone. It's your inner ankle bone. So if you are sitting cross-legged, it's the bones at your ankle that you're touching. Like I'm sitting cross-legged right now. And so that's your ankle bone on the inside, medial. And that's how you're going to know that this is middle. So you're going to know that this is the medial condyle because of the medial malleolus. Okay? And then here, and that's it. I think that's it. Because there's nothing else on the back, and you have to have the anterior to get that tibial tuberosity. So I don't know why we would have a posterior image. Study what's in Blackboard, but if there's only one image, it's going to be the tibial tuberosity, which is anterior, of course, medial malleolus, because the lateral malleolus is on the fibula. The lateral malleolus is not even on this bone, because the fibula is lateral to the tibia, and of course, conversely, the tibia is medial to the fibula. Okay, guys? So again, once you see that medial malleolus, then you know that this is medial condyle, lateral condyle. And it's just that kind of, they're labeled here, so. Okay? All right. Now, both of these images show the posterior and anterior fibula. There's two ways you can look at this. It either looks like a snake head, or it looks like a recorder. You know the stuff you used to play in school, which is awesome. Twinkle, twinkle, little star on the recorder. Anyway, or a snake head. So this does not compare and contrast. Make sure that you're looking at the tibia, not the tibia. Make sure that you're looking at the fibula, the ulna, and the radius, because they're long, skinny bones. I know. Yeah, I'm totally with you, because obviously I can't even get the deltoid tuberosity out of my brain. So it is the tibia and the fibula. So it's not the tibula. Be careful, guys. It's a very good reminder. Wow, Brisa, that's awesome. I know. Don't even say it. No, I'm with you, Halima, because if we say it, everyone's going to be writing it down, and it'll be the new name, which is not. So yes, the tibia, and then yes, and then you want to know whether this is the anterior. So what you want to look for is lateral. See this, guys? Not a styloid process. It's the lateral malleolus. So if it's lateral, it means that this has to be anterior. You know what I'm saying? Because this part here is proximal. This part here is distal. But honestly, it doesn't matter. With these images, with the fibula, it doesn't even matter. Because all you have to know is find that lateral malleolus, which obviously is here and here, and then that's all you need. I mean, all you need is a lateral malleolus. So this image, we don't care if it's anterior or posterior, only because all we're looking for is the actual bone, which is that fibula, and the little part here that sticks out. Not the styloid process, guys, not the styloid process. Wait, can you repeat the three again? Oh, I'm sorry. Oh, wait. Do you mean on the tibia or the fibula? Which three? Oh, sorry. The three skinny bones are this one, which is the fibula, the ulna, and the radius. So the two bones at the antebrachium. Exactly. Thank you. So those ones are just ones that you want to compare and contrast so that you don't mix them up when you get to the test. But for this one, oh yeah, no problem. I just didn't know, which is not shocking because clearly, sorry. But again, for this one, the fibula looks like a snake or a recorder with this, and it has that lateral malleolus, right? There's no medial malleolus. The medial malleolus on the tibia, which you can see here, which you do need to know because we've got a medial condyle, and then boom, opposite side, the lateral condyle, tibial tuberosity is anterior. All right, guys. Now, I fixed this, guys. I fixed it. I thought about it, and I realized what my mistake was. So I fixed it. Are you ready? Okay. The problem that I had was that I switched the cuboid for the navicular. And that's So, again, we start with, yeah, exactly, but it wasn't everything. Now, I did jack up other things because of that, but it's because I switched the cuboid and the navicular. So, what you want to do is this. Big toe. Remember the hand? The thumb, right? And it's the same idea. But in this case, we're talking about medial. Now, this is very important because it's the same counting idea, right? 1, 2, 3, right, guys? You're following this? 4, 5, okay? And that's exactly. Big toe, hallux, exactly. Now, it's the same thing, only instead of calling this the metacarpal, here, that's the metatarsal. These are the same names. First, second, third, fourth, fifth phalanges, distal, middle, proximal, middle, distal, except for the hallux, the big toe. The big toe, like the thumb, only has a distal and proximal bone. That makes sense, guys? So that, no problem. But you've got to start at the big toe, just like you have to start at the thumb. Okay, guys? And, of course, hallux and pollux for the thumb. All right. So, I got this because I thought about it. Calcaneus, talus, and I'm like double checking. Navicular, cuboid, going back to the medial. This is the, sorry, I'm showing medial cuneiform, intermediate cuneiform, and lateral cuneiform. See, I got it. What was it? See? It was easy. It's just I jacked up the cuboid and the navicular. That's it. They actually do articulate, yes, because the talus is going to articulate with a couple places as well. But that calcaneus actually goes in the front like this. Do you guys see that? So you actually can't see all of it. I got a cookie, sweet. I want money. No, does anyone know if there's a mnemonic for the tarsus like there is for the car? You guys all know me. I don't do mnemonics. Sorry, guys. When it comes to mnemonics, I can't even. But I will say, go posterior to anterior, right? And go medial to lateral. Thanks, Shannon. Appreciate you. Tips are always welcome. I'm kidding. You can't give teachers tips. That's unethical. Don't do that. All right, so here we go. Again, from posterior to anterior, calcaneus, talus, navicular, which is medial, cuboid, which is long, right? And then we go back to the 3 cuneiform, which is medial, know your medial, intermediate, and lateral, right, guys? Just like this picture on the opposite side, medial, intermediate, lateral, because that's medial. I did it! I didn't jack it up. Woo! Just move on from deltoid tuberosity, guys. Just gluteal tuberosity on the femur. Gluteal tuberosity on the femur. Oh, I get a cake. I'm so special. Someone give me a raise. That's I can go for. This is never gonna happen. All right, guys. Anyway, oh, thanks. Does that make sense? That's it. Boom, you're done. Okay, awesome. Perfect. All right, guys. Page 76. Flip over your books. Let's do it. Now, what do you have to know? You have to be able to tell the different vertebrae, but not all of them. So you have to know C1 and C2, which is easy, trust me. You have to know what the cervical vertebra look like, easy, trust me. Thoracic vertebra and lumbar, easy. So we're not going to give you like a thoracic vertebra and say, is this T4 or T11? No. You just have to know that that's a thoracic vertebra. And then you're going to have to know the bone markings on all the vertebra, which again, not that bad. What was the phrase to remember for the hand? I don't know. Does someone want to help her out? Does someone know the mnemonic for the hand, guys, or the wrist? The hand doesn't have it, the wrist does. Anybody know the mnemonic for the wrist, guys? Okay, so that would be scaphoid, lunate, trichetrum, pisiform, trapezium, trapezoid, capitate, hamate. See, I can't remember that, but I can remember everything I just told you. I know. I don't know what happened to my brain. It must be because I lived in a cold climate for so long. Try to catch her. She looks too pretty. That's not bad. That's not bad. Still. Yeah, a lot of people like it, and I say go for it. I just can't do it. All right, guys, let's do it. Let's knock this out. Okay, so this is an example of a vertebra. It happens to be a cervical vertebra, which I will talk about in a second, but let's knock out the second column that says on all vertebra, and this is page 76. So, on all vertebra, we have something called the lamina and pedicle. We usually ask it here, because what you see here is it gets really kind of tight in this area. And so technically this is the lamina and this is the pedicle. But guys, look what the words say. They say, where is it? It's about 1, 2, 3, 4, 5. It's about the fifth one. It says lamina and pedicle, right? And so lamina and pedicle is what you're going to write. So it doesn't matter whether whether we put an arrow like this or put an arrow like here. Obviously, I'm putting a circle. We're going to call that the lamina and pedicle. But again, we tend to put it here because there's so much more room to do that. As a stub. All right. I don't know. Tanya.
So just to be clear, you're saying on the test that even if it's only pointing to the lamina, we need to label lamina and pedicle.
Exactly. Because, all right, guys, are you ready? What does it say on page 76? Start writing. Go. It says what for the lamina? Go. On all vertebra, 1, 2, 3, 4, 5. Number 5, lamina and pedicle. Lamina and pedicle. Lamina and pedicle. So, Tanya, what are you going to write if you see just an arrow here? What are you going to write? Lamina and pedicle, because it's on the list. That's why. Don't overthink it. Don't think about it beyond, hey, it's probably going to be here, but technically that's lamina and that's pedicle. We call them lamina and pedicle for that reason. And basically what they're trying to say is like this whole circular area there, the bone part. All right, awesome. Now, spinous process is here. This is posterior. This is anterior, just so that you know, right? Because the spinal cord goes in the middle and all of this protects it. So the middle is called the vertebral foramen. It's a big hole, okay? Now, with that being said, this is the transverse process, but it's not a great example because it's so tiny, right? And I'll show you a much nicer transverse process in a second. Here is the vertebral body, but I don't even think they want it. They don't want the vertebral body, which is weird. Now, you cannot see the intervertebral foramen here. I will show you in a second. Transverse process. Now, guys, you see it here, but again, there's a better picture, so we'll get to there in a second. There is something called let me see, where is it? Where is it? Transverse foramina. Guys, if you go back to the cervical vertebra labeling to the left of that, they're transverse foramina. So here is the transverse foramina. It is don't worry that this one says foramen. It's not wrong. Just go by the spelling in your book. Don't let that freak you out, right, guys? So transverse foramina is the hole by the transverse process, and you only see that in the cervical vertebra. So it means if you see a vertebra picture like this, right, and there's a little bit of a hole to the side, that has to be cervical. Lumbar does not have that transverse foramina, and neither does the thoracic. Okay, guys, so that's your tip. If you see that hole, not the middle, they all have the vertebral foramen. This little transverse foramen, that tells you that that's a cervical vertebra. I will show you C1 and C2, atlas and axis, in just a second. Okay, guys? Okay, so we gotta go, but we can do this. Blah. So here's an image that's all labeled. Again, this is not what you're gonna. It's a fine typical image, so that you know this is a thoracic vertebra. You can see there is no transverse foramina there, right? So this is a thoracic vertebra, vertebral foramen. Now, superior articular process. It's actually something that it's more sideways. Do you guys see this right there? I'll show you in another picture, don't worry. that's called the superior articular process, because each vertebra have a superior articular process, except for C1. It does have an articular process. It's just different because it articulates with the occipital condyle. Yes. Yes. So this one here, okay. This is called the facet. The whole thing that sticks out is called the process. So the facet is it's kind of like a fossa. It's just that part there. That's the facet. What is it? Yeah, whatever it says, go with the plural. So it's fine to say facet. I don't care if you say facet or facets, but just stick with whatever you see here. So here, the superior articular facet is it's the flat part on this process. Okay, it's the flat part, and this is the transverse process. And now let me keep going so that I don't confuse you. Now here, you must get a side view, guys, to see the intervertebral foramen. You guys see what I did here? Right? If you want to see the transverse foramen, you got to be looking down from like above, or technically below, but we don't have it. That's weird. And then we have the vertebral foramen, which is the middle. You have to get this lateral view to see that. This is where the 31 spinal nerves come out between your vertebra. So again, boom, 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 boom. Intervertebral foramen. Okay, guys? Now, here's a good image for the inferior. You're not going to get this image, but see this? This is the superior. This is going to be the superior articular facet, and this is the inferior articular facet. Do you guys see how that works? There's an inferior articular facet there. Okay? This is one vertebra here. I've got a superior articular facet and an inferior articular facet. Okay? All right. So, let's keep going. Cervical see this here? Transverse foramina. Now, okay. C2, the axis does not really have that. But do you see this part in the middle? This is called the dens or the odontoid, but you can call it dens because it's easier. That part sticking up tells you immediately C2, which is axis. This is C1 because the articular facet here is it's different because of the way the condyles are on the occipital bone. Yes, Christina.
Okay, so this point, wait, how do you circle so you know what I'm talking about?
Yeah, go ahead and click on the pen.
Do you see this?
Yeah.
Okay, so this right here, that is the spinous process.
So
right
technically, but we would never ask on that because you just can't see it. So you can see how this one is more of a developed spinous process. Most likely, we're going to ask on.
This is just the top view of the cervical.
Yes. So really, the cervical doesn't really have a spinous process because it's so high up that it doesn't actually kind of stick out. Because remember, the occipital bone is it goes quite low underneath the kind of the skull. And right there at that occipital condyle is where this bone meets. And it's almost like the occipital bone is there.
This type of view is what you kind of won't see this type of view.
You might see this view because this is Blackboard. You're going to see any of the views. So you can see the superior view.
Is right, the lamina and pedicle?
Yes, exactly. So lamina and pedicle are going to be there, and they're going to be here.
Okay, thanks.
Yep, you're welcome. All right, guys. So C1, C2. C1 is oh my God, stop. Sorry, that was me. Not you guys, me. C1, C2. C1 is here, and that's the atlas. C2 is here with the dens, and that's the axis. This one gives me yes motion. This one gives me no motion. Okay? Or flexion and rotation. All right. Awesome. And this is them. So this is just an internet picture. It was just nice because you can see them together, right? The top one here is C1, and the bottom one with the dens sticking up here is C2. And then you can see the really pretty spinous process on C2. And then here you can see that transverse foramen on C1 with the transverse foramen here and then the transverse process here. This is a nice transverse process, even though it's small. All right, that's it. So this is image from, there's a couple images that they have for the vertebra, so look at all of them. So as you can see, these vertebrae get bigger: cervical, thoracic, lumbar. Okay, and here you can see images of the superior articular facet right there. Superior articular facet, like the ears of an animal. This is a transverse process here, and then there's a process articulate. That's going to be a superior articulate process as well. It's like a flattened part where two of the articular facets meet. All right. Here's another image. This one's not on Blackboard, so I don't want to go into too much other than the transverse process. That's the spinous process, vertebral foramen, and there is the superior articular facet. Again, it's kind of like a flat area where these facets are going to articulate. Yeah. Yep. You can see that here, which this one is from Blackboard. Cervical, thoracic, lumbar. Now, there's no transverse foramen, so that can't be cervical, and it's not big enough to be lumbar. And this is lumbar. You can see how big it is. That body of the vertebra is really big. That's an articular facet. That's the spinous process. That would be the transverse foramen, but it's kind of small. All right, that's it. We got everything, right? Yeah, that's it. All right, sacrum. I keep missing the facet. Okay, hold on. So let me go up here to this one so that you see. So the facet is going to be where the vertebra meet, right? They're going to articulate at the facets. So each of the vertebra are going to have a superior articular facet and an inferior articular facet. Now, this one is not on Blackboard, but it's just here for instructional purposes. So do you see this part right here that looks flat? That's a facet. That's an articular facet. Now, you can't see the flat part here, but you can see that it's going to articulate. That's a superior articular facet on this guy here. That's the inferior articular facet on this guy here. No, facet's fine. Whether you say facet or facets is fine. Does that make sense a little bit? Yeah. But you got that, when you see it in this image, then you can see it in the other images. Like here, watch this one. You see this? That's the inferior articular facet of this one. And then this is the superior articular facet of this vertebra. Always, for the foramen and foramen, go with the book. Because as you can see, some of my slides say foramen, but I want you to go with the book for foramina. So the inferior visible from the other angle. So there's the inferior visible from the other angle. You can see, so this one you can't see because the superior, well, this one is the inferior here. Oh, I see what you're saying. Okay, yeah, let me go back. Okay, hold on. Let me go to the Blackboard images. Facet, superior articular facet. Superior articular facet. Superior, this one is superior articular facet, inferior articular facet. The angles where you can see the foramen. The angles where you can see the foramen. It has to be superior, right? It has to be like this, because you can't see it in any other angle. Brisa, did that answer your question? In order to see the foramen or foramina, foramen, use the book, whatever it says here. In order to see the foramen, you have to have this image, right? So this is going to be the vertebral foramen. This is the transverse foramina. You can't see the inferior from this angle. The inferior articular facet, or what inferior do you mean? There's only an inferior articular facet. From this angle, no, you can't. but you can see it a little bit. There is a side image that I don't have on here. So there is a lateral image where you can see the facets. But, sorry guys, I don't have it on here. I'm not 100% sure why that is. Sorry. I'm just seeing if I can find one. So I don't have the lateral one. You need the lateral to see the superior inferior facets. Are you sure there's not a side one? I think there is. Check again. All right. So the way you want to think about it is like this then. Okay, process. Hold up. Oh, I gotta hurry up. We got 5 minutes. Okay, I don't want you guys to overthink it. Just know that you've got to have the spinous is going to be on the back. This is actually the back right here. The nose of the animal is the back. Spinous, spinous, spinous. Okay, that's your back. So this is going to be the transverse foramen. Transverse foramen. This part you can't actually see it because it's the back. These are the superior articular facets. That's a superior articular facet, a flat part. Okay, I hope that helps. All right, guys, I gotta get your not a big deal. Top is the sacral promontory, right? That's the top, superior. All the holes here are called sacral foramina, and the coccyx is just a little bone at the very end. Okay, guys. So because we only have a couple minutes, I want to get to these. Okay, now. This is not the image on Blackboard, but it's the same idea. It's all labeled. So first of all, take a picture. It's not a big deal. This is what you got to know, right? Look at the femur, condyles. You know that's the back. Boom. Okay. Look at the front. You're going to have that ligament, but they may move it out of the way a little bit to get the picture of the patella, right, guys? Now, what else is important here? Back is the condyle on the femur. Front is going to be the clear ligament here, right? This is a tendon coming from the quadriceps. Now, what else is important? There's the tibia. You guys see that? The tibia is the big bone that articulates with the femur. The fibula is the little bone, right? Which means this ligament, lateral ligament, is the fibular collateral ligament. Lateral, right? And then here, I've got the tibial. Well, it doesn't work there because it's actually medial, but that's okay. Tibial collateral ligament. Does that make sense? If you know your fibula, that ligament is fibular. If you know your tibia, that ligament is tibular. Got it? And that's what you can use. Tibia, not tibular. Tibial and fibular. That's easy. And then the back, you got to know your back so you know posterior cruciate ligament, right? And the front, we got to move over this ligament a little bit to see the anterior cruciate ligament. All right, guys, you with me? And then you can see that little bit of anterior cruciate ligament from the back. And in the front, when we move this, you can see the little bit of the posterior cruciate ligament as well, because they go through. And then lastly, you got to know your front and back and tibia and fibula, so you know that the fibula is lateral, making this the lateral meniscus, this the medial meniscus. That's it. Most of this, because you already know fibular collateral ligament is easy, tibial collateral ligament is easy, right? It's about orientation for this. Right, guys? Make sense? Now, the shoulder. You know your bones, you know your ligaments, right? So first of all, they want you to know the humerus, which is obviously here. That's the clavicle, that's the scapula. Shocking no one, this is the front, so this is the acromion. The acromioclavicular ligament. Boom. This is the front, again, and this is the coracoid process. So, shocking no one, this is the coracoacromial ligament. Why? Acromion, coracoid process. Right, guys? And then lastly, clavicle, coracoid, coracoclavicular ligament. Does that make sense? So this one, you know your bones, you know your ligaments. This one, you know your front and back, and of course you got to know your tibia and fibula, right, guys? And that is it. That's not bad. This is the image on Blackboard. This one's not. Sorry, I cheated a little bit because it was all labeled. All right, guys, that makes sense? And again, you already know your patella. We have to move that out of the way to see it. All right, guys, go get it. Go get it. All right? You can do it. I know, I did it. Amazing. Even with a break. All right, guys, you guys got it. All right, awesome. Have a good weekend. Study hard. You got this. Chunk it together. All right, guys? Good night, guys. No class next Friday. Study hard. You're welcome.